Can we start? It's 5.
Has Hema joined?
I called her. She said she.
Hello, Ram Swami.
Hello, sir. Namaskar.
Namaskar. I think it's time we should start in time.
Yeah. So, if Hema is not there, Krishnapriya, can you start? I will call Hema side by side. Please. Let's go with the time.
Yes.
We have Munira and you can manage.
Sure.
It's 5 now. We start now. Please. Tarun, are you okay now to start?
Yeah, we can start, sir.
Okay.
So I'll start.
Please go ahead.
Mahaniya Medhaven Twadiyam Swagatam Kurmaha Guro Girvana Bhashayaha Twadiyam Swagatam Kurmaha. In Sanskrit, Swagatam means welcome. And the verse I just recited means welcome all brilliant intellectuals. Welcome mentors, dispellers of ignorance, whose language is sharp as an arrow. This is very apt for this truly global event, since now we have 5 regions: India, USA, Japan, Southeast Asia, Australia, New Zealand, Europe, and UK, all with different languages, being part of this global competition. And it is truly the mentors who have sharpened the skills of the young researchers and honed them to this high level. On behalf of the Society of Pharmaceutical Dissolution Science, SPDS, and the whole team of Dissolution Research Presentations International, DRPI, I have the proud privilege of welcoming each one of you to the grand finale of this global competition to select the young researcher in dissolution science in 2 categories: early research category, encompassing research presented by Masters and PharmD students, and late research category, which includes research presentations from doctoral and postdoctoral students and participants from the industry. Today, we will be witnessing the presentations of late researcher category, that is PhD, postdoc, and industry. We have 10 of them. And tomorrow, we witness the competition among the early researcher category, followed by the valedictory function, where the results of both today and tomorrow will be announced. The genesis of DRPI took place when Professor Saranjit Singh, presently our DRPI Global Chair, was chairperson for a session at DISO India 2020, a scientific conference based on dissolution, which was held online for the first time due to the pandemic. He expressed the desire to have a platform for the students to present their research in an online mode, and DISO Research Presentations India was born, with Dr. L. Ramaswamy, General Secretary SPDS, spearheading the process of getting DRPI functional in around 10 days' time. The process began with abstract submission and evaluation by a dedicated team of evaluators to check whether the abstracts are focused on dissolution and 4 other allied themes, including formulation development and release mechanism, IV-IVC, IV-RT, and IV-PT studies, biorelevant medium, pharmacokinetic studies, computational studies, and PBPK modeling. This was followed by submission of video presentations and their evaluation, progressing to the semi-finals and finals, where there were question and answer sessions too. This event was unique The evaluation procedure was stringent, anonymously presented, digitally monitored, and all efforts kept to keep it unbiased. After 3 years of DRPI India, one of the international judges suggested going global, and that was how Dissolution Research Presentations India was transformed to Dissolution Research Presentations International. And today we are witnessing the grand finale across various regions and time zones. Once again, we welcome all the participants, their mentors, the dignitaries from across the world, the chairs, vice chairs of all regions, the organizing team of each region, SPDS office bearers, academicians, students, and all those who have joined to be part of this great knowledge sharing forum and event. Let us now begin this global event with the Saraswati Vandana, a prayer to Goddess of Learning.
या कुन्देन्दुतुषारहार धवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युत शङ्कर प्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा.
Hema, you're on mute. Hema, you're on mute.
Hello? Yeah. So that was both divine and melodious in equal measures. As we go ahead, hello everyone. So this is Hema here, and it's my proud prestige and privilege to welcome to this virtual dais President, Society for Pharmaceutical Dissolution Science, Dr. Padma Devarajan. Madam is Dean, Research and Innovation and Professor in Pharmacy and former HOD, Department of Pharmaceutical Sciences and Technology, Institute of Chemical Technology, ICT, commonly known as Mumbai. Welcome, Madam, and looking forward to hear from you.
Thank you, Hema. Good morning, good afternoon, good evening to all our collaborators, guests, students, scientists across the globe. Today is indeed a very auspicious occasion because we celebrate two important events. One is, of course, the global finale of the Dissolution Research Presentations International, let's say the inaugural international event, which we hope goes from strength to strength over the years, and a very personal event, the birthday of the founder, member of the Society for Dissolution Sciences, none other than Dr. Vinod Shah. So what a day to choose for launching this wonderful international global finale. It is indeed a great privilege for me to be here to welcome all of you to this great event put together by SPDS. We have Dr. Saranjit Singh, who would be telling us a little more than what Krishna Priya just told us about DRPI. So I will tell you a lot about the mother organization whose one flagship event is DRPI. So the Society for Pharmaceutical Dissolution Sciences, which we call as SPDS, is just about 10 years old, and in 10 years has accomplished, we believe, a good amount of scientific and disseminated the scientific knowledge across not only India, but across the globe. A flagship event that started with SPDS was DISO India. And DISO India has been going on every year, including during the pandemic, without stopping. But we did not stop there. And DRPI is not our first global flagship event. DISO India has gone global already earlier, and we had DISO Romania, DISO Asia, and more importantly, in 2020, SPDS had the first chapter of SPDS launched in US, thanks to Dr. Vinod Shah and the team from APS who supported us in this. And SPDS US has already had 2 international DISO US. So this SPDS has been spreading its wings far and wide and at great rapid speed. Other than this flagship event, SPDS is also responsible for having already brought out 2 desk books of dissolution science. When I say 2, it's 2 editions of the desk book of dissolution science. And these 2 books are really coveted books by various research laboratories because they find it very, very useful and handy, and also enabling for troubleshooting. The other important activity that SPDS has been involved with in the initial years is a certificate course in dissolution science and technology, which was run across 6 weeks. And this catered majorly to industry, particularly to scientists from the QC, QA, and the R&D, typical formulation R&D, to hone them in their skills in dissolution and understanding the various nuances and applications of dissolution science, including maybe interpretation, automation, and everything as dissolution progressed was brought to the forefront of these workshops that we had. What is our next future plan? We are looking forward to set up a center of excellence in dissolution testing, where we put together all the various dissolution apparatus and the relevant analytical techniques. And we want to make this one center that would cater initially to all institutions across the country. So we're also trying to locate it in a place which is accessible, and also ensuring that people who need to come from far distances would probably have a place to stay for a few days and then learn, carry out their studies, and then go back feeling very fruitful in their endeavor. So SPDS is here spiraling upwards, trying to provide everything under the sun related to dissolution science and technology. And what we are going to witness today is one huge event of SPDS, the DRPI, or the Dissolution Research Presentations. And I must say, we are extremely thankful to each one from all the different parts of the globe who have supported us in this. We have right here in front of me, I can see very eminent people. I can see Dr. Matthias, Dr. Patnala, James Pauly. I can see Dr. Kamal Dua, Samir Haduchi, who's been with DISO and SPDS, I think right from the beginning. We also have Dr. Sandeep Tiwari, and the others. I'm not able to see them here, but to everybody who has been in the forefront or behind the scene, thank you so much for enabling success of DRPI. We look forward to 2 days of great excitement, great learning, and great inspiration. So with this, let me welcome all of you once again to this great event today. May we witness something historic. Thank you.
Thank you, Madam, for that update on SPDS and its activities, past, present, and future. It's now my immense pleasure to welcome dear Professor Saranjeet Singh, sir, the brain behind this whole idea of having a DRPI, our global chair for DRPI International 2023. Professor Saranjeet Singh is ex-professor and HOD for pharmaceutical analysis at NIPER Mohali. Welcome, sir.
Thank you, Dr. Hema. Very good morning, good afternoon, good evening from my side to all. And I wish legendary Dr. Vinod Pisha very, very happy birthday. Praying for your good health, your longevity, so that you can go on patronizing us as much as God desires. Thank you so much for inviting me here today. And I'm happy that DRPI, we started with a small effort in 2020 when we were online and there was no event for students. And my suggestion was taken up very fast by Dr. Ramasamy and we implemented. The success of DRPI, the first year was having many of the teachers associated with this program of DRPI India at that moment, and having all the 4 zones within the India. And this event we successfully conducted in 2020, 21, 22, when the idea emerged that why don't we bring all the students globally to one platform and have a competition arranged for them. I am knowing that different regions of the world have their own way of working, their own style of working, their own cultures, and to have everybody connected to each other and have a global competition. It was a little, a deep thought process that was required. And we decided at that moment that when we go into the globals, then we have to respect the way the world does, the way each region will be doing their own competitions. So with that prime requirement that respecting all the regions, and second on the top of it was our association and the umbrella the support which was provided by APS. And you can all know that what are the standards, you all know what are the standards of APS in conducting any program. And it is very, very happy situation for me that we could meet those standards of APS, and we had the competition for US. We had Dr. James Pauly who conducted that, Dr. Matthias conducted JSCA, and Dr. Kamal of Australia. So this way, and the other prime requirement of mine, particularly when the events were held in India, was that this competition has to be totally fair, unbiased, so that we set up the credibility of this competition before we go global. So we tried this for 3 years, were very successful. With support of Mr. Tarun, we set up a backbone platform for that. And I see that this platform that has been created, it's the first time in the world that we have such an event that can be conducted at that scale. I'm extremely thankful to our chairs and co-chairs in each region that they have supported us, and my best wishes for the competitors. They are going to compete for the coveted award of the Dissolution Researcher, World Researcher, and the encouragement they are going to be getting through winning this competition, and also the financial awards sponsored by BSF, ACG Worldwide, and SOTEX. So with these small many words, I would say that all the competitors are present today. You are all the winners that you have reached to the stage of grand finale. And don't consider yourself as a loser if you don't win the first, second, third rank prize. To come to this stage is enough good winning point. And my dream for the next years is that in each region, we should be able to involve all the universities in each region and the students from each of the university in the region in this competition. Let it be a true global competition with participation of student and researcher from each university. With this, I convey my best wishes. Thank you so much.
Thank you, Professor. And before I hand over to Dr. Munira, I would like to say happy birthday, sir, to Dr. Shah. Dr. Munira, please take over.
Thank you. This is Dr. Munira Momin. Good morning, good afternoon, and good evening, and with very warm welcome on virtual platform of DRPI Global Finale. As all of you heard, Dr. Saranjit Singh said that it started with DRPI India, and COVID has given us a lot of opportunities to learn and spread knowledge. And that's where DRPI India started with 4 zones. And imagine we are today with 5 zones across the world, the entire global presence. And that's our grand global finale. It's my privilege to welcome chairs of different region. Today with us, we have DRPI USA Chair, Dr. James Foley. He's associated with Department of Pharmacy. He's associated with University of Maryland, endowed chair in Industry of Pharmacy and Pharmaceutics with the School of Pharmacy in Maryland. We have another chair of Japan and Southeast Asia, Dr. Matthias Wecker. He is associated with Department of Pharmacy, National University of Singapore. And we have one more chair today with us is Dr. Kamal Dua. Dr. Kamal Dua is a senior lecturer at University of Technology, Sydney, Australia. We really appreciate each chair and vice chair. We realize that there is a whole bunch of time and efforts and planning goes behind when there is any event to be organized. We would like to listen from all the 3 chairs, those who are present today, if they can share their thoughts about DRPI in their region, as well as the entire concept of DRPI, how the students and the professionals associated with dissolution have started feeling this a kind of a competition. But I always say as a teacher, rather than it's a competition, it's spreading the knowledge, sharing the knowledge, equipping students with the advancement in dissolution science. So over to you. We may should we start with Dr. James Foley? May I request Dr. James Foley to share his views?
Sure, it's a real pleasure and privilege to be with you here today. DRPI Global Chair, Dr. Singh, and everyone, good morning, good afternoon, good evening. Greetings from the US. Thank you for involving late stage and early stage researchers from the USA in DRPI. These trainees have benefited from participating in DRPI in terms of improving their own work and presentation, as well as learning from others. DRPI was successful and benefited greatly from adopting what you have developed and revised over time. As you know, the national competition is rigorous, involving the subsequent phases of abstract, recorded presentation, and live event with questions from and answers from judges. But this rigorous process also highlights the important role of dissolution and release science in drug product development and assessment. Sort of on a personal level, much thanks to Professor Hardeep Shaluja. I very much enjoyed working with you and making DRPI US happen. Much thanks to the American Association of Pharmaceutical Scientists, AAPS, especially Pat Cinco and Tina Morris for promoting DRPI US. Much thanks to the judges, coordinators, Dr. Ji Shen and Sanjay Patel, as well as the AAPS in vitro release and dissolution community for serving as judges. Much thanks for Dr. Ramaswamy and Dr. Shah. Dr. Shah, congratulations on your 29th birthday. For all your support over the last year in making DRPI US happen. Much thanks also to Taryn and Dana for great IT and technical support. So really great privilege to be involved in this. Much appreciated for the trainees in the US. And best wishes to all of today's and tomorrow's trainees. Thank you very much.
Thank you, Dr. James. May I request Dr. Matthias Wecker to share his views, please?
Yeah, thank you very much. First of all, also thanks for the chance to say a couple of words about the Japan and Southeast Asian chapter of DRPI. I can say it was an amazing event that we also were invited to contribute to this international organization. I can say that SPDS also kind of was the point where I said, okay, that is something we have to contribute because science is international, science is interdisciplinary, and particularly when you're in Singapore, then you feel that because you have a lot of small countries basically in this corner who basically together also form an amazing and very vibrant community. And I think that is also what the core of our event was. We had a lot of challenges, of course. We have heard about the challenges, but actually, I think our students and the supporters of DRPI together mastered those challenges, and that was really the important part. We found amazing sponsors, SOTAX. We also had other sponsors from the Singapore region, like Malvan and Pharmatest, who basically also supported the event. We had then our students. We have an AAPS NOS student chapter in Singapore who did the hard work by basically bringing together everything and making a concept and also being our interface to the other organizations, to SPDS and to DRPI International. And that altogether made it for me an amazing opportunity to also push for this event and mostly to push for our students. And I think if you have any questions, if they benefited from it, then you probably is the best to ask them, because they are presenting today, and we are very proud that we also could send a few into this race, and may the best win.
Thank you, Dr. Becker. May I request Dr. Kamal Dua to share his views, please?
Thank you, Dr. Momin. Thank you. It's an absolute pleasure actually to join as a chair of the Dissolution Research Presentations International 2023 for the Australia and New Zealand chapter. First of all, I would like to definitely wish Dr. Shah a very happy birthday. Just as a history, it is the very first time lately the Australia and New Zealand chapter has been set up, and now I can proudly say that we have a chapter in the Society of Pharmaceutical Dissolution Society representing Australia and New Zealand. We got some excellent actually entries, and I'm sure you'll hear some of that amazing presentations in the event. It was a bit challenging because we set up this actually Australia and New Zealand chapter very lately, but however, there was an enormous support from two people, and I would like to sincerely thank those two people here, Dr. Ramaswamy and Tarun. Amazingly, the enormous support they had given was incredible. A big hand to both of you. I would also like to thank the co-chair of the Australia and New Zealand chapter, which is Dr. Lai Feng from the University of Sydney. I believe he's also might be today present here. He was a great support, and he works very in parallel to me in getting those collation of those abstracts and entries into this event. Last but not the least, actually, my deepest gratitude to all the organizing committee, our sponsors, and all the contributors actually who have made this event possible. It's really a pleasure seeing everyone here and looking forward to the talks now. I don't think I should hold long. People say I don't stop when I start. Particularly, I got that from even Dr. Rama when I was lately in the CRS conference in Mumbai. So thanks again, and I welcome everyone to the event. Thank you. Thanks, Dr. Momin.
Thank you, Dr. Kamal. I'll take 1 minute with the permission of Dr. Saranjit. For the benefit of the students, some of them have joined Global Finale, and then some of the members from UAE have joined. I just want to inform about, we have a DRPI 5 region, Australia, New Zealand, which is headed by Dr. Kamal Dua and Dr. Lai Feng. Japan and Southeast Asia region is headed by Dr. Matthias Becker and Dr. Atsushi. The Europe region is by Dr. Nicoletta Futaki and Dr. Deirdre Darcy, and DRPI USA region is headed by Dr. James Pauly and Dr. Hardeep Saluja, and the DRPI India, this DRPI Global would not have been possible without the chair, Dr. Saranjit Singh, and Dr. Krishna Priya, vice chair. Thank you very much. Thank you, Dr. Ramaswamy, for always infusing that energy which not only we teacher, but students also, they envy and they see, they learn from you, they get motivated from you. So thank you very much to all the chair, co-chairs. Thank you all the judges. Warm welcome to all of you on this virtual platform of DRPI Global Finale. And all the members of SPDS. Thank you very much. Over to you, Dr. Krishnapriya.
Thank you, Dr. Munira. And I would now request Tarun, so that we are eagerly awaiting the research presentations to begin, so he can take over from now. Over to Tarun Soni.
Thank you, Dr. Krishnapriya. Am I audible?
Yes,
Yes.
you're audible. Tarun, can you just check with all the judges? They have everything set?
Yeah, sure. So I hope all the judges could log in into the portal. First of all, I would like to welcome you all and good morning, good afternoon, good evening to all the participants, invitees, judges, and the panelists. And very happy birthday to Dr. Shah. My name is Tarun Soni, and today I would take you through 10 excellent, insightful research presentations by the best young pharmaceutical researchers from around the world. The research ideas and findings presented by these researchers would be of profound interest to pharma industry and academia. Each recorded presentation would run for 10 minutes, after which our judges would interact with the presenters in question and answer session for 5 minutes. After the five minutes of question and answer, the judges would be provided with another 5 minutes to record their evaluation and valuable remarks for the presenter. During these 5 minutes, when the evaluators are recording their remarks, we would be running silently the video of our platinum sponsors ACG and SOTAX and our gold sponsor BASF. So with this, we'll move from east to west. So let us begin our first presentation from DRPI Australia and New Zealand. The topic of the presentation is, let me share my screen. The topic is controlled release of vancomycin from PF Pegra hydrogel.
Hello everyone. Today my topic is controlled release of vancomycin from PF Pegra hydrogel. Surgical site infection is a prevalent concern in the aftermath of surgeries and contribution to approximately 3% of surgical mortality rates in the United States. For median stereotomy, which is a technique used in open heart surgery, a rare but serious complication known as sternal wound infection, including deep sternal wound infection, is often associated with this procedure. This infection not only prolongs hospital stays, but also poses severe complications. It can prolong hospital stay and may lead to requiring a secondary surgery, increasing the risk of morbidity and mortality. Therefore, it is significant for all cardiac surgeries to prevent the SSI. Vancomycin paste is an example of topic antibiotics that has been used by surgeons for many years to prevent the SSI. It can be prepared by simply mixing vancomycin powder in normal saline and then applied to the cut sternal edges. On the other hand, localized delivery of high concentration antibiotics is still of great interest in the surgical field, as it offers target drug delivery, controlled drug release, but without side effect compared with the injection. To adverse the use of topical antibiotics for the SSI, recent studies investigate using the hydrogel as a drug delivery system for antibiotics. Hydrogel are three-dimensional networks composed of cross-linked hydrophilic polymers. In recent years, its use as a drug delivery system has been widely studied due to its ability to encapsulate drugs and control drug release. Localized controlled drug delivery is especially useful for drugs like vancomycin with poor absorption and fast elimination rate. By loading vancomycin in the hydrogel, it enables the sustained release of vancomycin at the surgical site for antibiotic effects. Therefore, in these studies, we propose to build a localized vancomycin-laden hydrogel to prevent the SSI. And we will adjust the configuration of the hydrogel to accomplish controlled release of vancomycin. And in the end, we will build a mathematical model to simulate the vancomycin releasing profile through the hydrogel to guide the personalized medicine. So how we make the hydrogel? The PF solution is prepared by mixing the pacta with the fibrinogen in PBS, and then 20% of the pacta stock solution was prepared for further addition into the PF solution to control the stiffness of the hydrogel. After that, the PF solution was mixed with the photoinitiator and exposed to the UV light. This enabled the cross-linking of polymers while photopolymerization process to produce the hydrogels. Finally, the multiple hydrogels with different pacta concentration was created. So to control the vancomycin releasing from the hydrogel, two configuration was developed. Method one is by adding vancomycin solution to the PF pacta hydrogel solution, and before cross-linking, and then curing under the UV to form the vancomycin-laden hydrogel. Method two is by curing the PF pacta hydrogel first, and then loading the vancomycin solution on top of the blank hydrogel. To simulate the drug release for the vancomycin-laden hydrogel and the vancomycin on top of the blank hydrogel, the diffusion mechanism are calculated by the fixed second law. In the equation, the C is concentration of the vancomycin, T is the time, D is the diffusion coefficient. And then we use the Hagraft-derived fixed second law to find out the relation between the real-time released vancomycin with the total amount of the loaded vancomycin. The MT is real-time released vancomycin, and M infinite is the total amount of the loaded vancomycin. Here is the result of cumulative release of vancomycin from the PF hydrogel with different pacta concentration over time. The figure A is the vancomycin-laden PF pacta hydrogel, which shows typical burst release, and figure B is the vancomycin solution on top of the PF pacta hydrogel, which shows lag release. And the result shows that for hydrogel with higher pacta concentration, the drug release is slower. To define the antibacterial ability, the diameter of the bacterial growth inhibited zone were measured. The diameter of ZOI varied depending on the pacta concentration. As the additional pacta concentration increased, the ZOI would decrease. This agrees with the vancomycin releasing study. The higher the pacta concentration, the slower the drug release from the hydrogel. So fixed law, second law was used to simulate the vancomycin releasing profile. Figure A is vancomycin burst release, and figure B and C are vancomycin burst release profile with the time and the square root of the time, containing 0%, 2%, and 6% of the pacta. Figure D is vancomycin lag release, and figure E is the vancomycin lag release profile with the time. Figure F is the combined release profile between the burst and the lag release. Initially, the release curve is driven by the burst release from the vancomycin-laden hydrogel. However, as the value of the x-axis set it to more than 0.1, the drug depot on top of the hydrogel begins to contribute to the combined drug release profile, and eventually becomes the main contributor in the combined drug releasing. So in these studies, we have built the packed hydrogel for a localized release system to deliver the vancomycin 2. And turnable mechanical property permits the manipulation of drug release to suit the different therapy needs. And two configurations were designed to achieve the burst, lag, and combined release from the hydrogel. And finally, the drug release kinetics can be described by modified fixed second law model. This mathematical model would be helpful in guiding the design of controlled release hydrogel for personalized clinical application. Thanks for listening.
So thank you for that wonderful presentation. This was presented by Unong Wan from the University of Sydney, New South Wales, Australia. Unong is already on the panel. Judges may please proceed with the question and answers.
Yeah, can I start? Thank you for the presentation. Very interesting. It was a nice content. Can you elaborate about the conditions that you used to compare the both types of formulations for the in vitro condition?
For the first one, we directly mix vancomycin in the hydrogel, and the second one we mix the hydrogel first and add the vancomycin solution on the top of it, and then we apply it into the antibacterial test and the drug releasing test.
Okay. Thank you.
Thank you.
Thanks for your good presentation. Really appreciate your work. My question is, what was the method of analysis for the drug release of vancomycin? Which method was used? And the second question I can't like to continue so that you can answer is, what was the stability of vancomycin in these gels?
Sorry, could you speak again? I couldn't hear it very clearly.
Yeah, how was the drug release evaluated? What was the method of analysis?
It's because it's released from the hydrogel, so it's a passive release. So when we mix vancomycin into the hydrogel, it will gradually release from the inner hydrogel to the outside. So it's passively released. So that's why we could use fixed law to simulate this process of the vancomycin releasing from hydrogel.
Now, how did you assess the concentration of vancomycin? How did you know that X amount of vancomycin was released?
For example, if at first we make 1 ml of the packed solution, and then we add certain amount of the drugs into it, and then we could calculate the concentration of the packed hydrogel containing a certain amount of the concentration of the vancomycin.
Yeah, my insight was, what was the method that was used, whether it was a UE or a HPLC, because there was no mention of the method in your abstract.
Yeah, we could collect the after we put the vancomycin laden hydrogel into a solution, and then we collect a solution a bit, like the 1 microliter, and then use the HPLC to test the concentration of it, and then we could get the released amount of the vancomycin.
And what is the stability of vancomycin in this hydrogel?
That's a good question. I think we might haven't considered about that. Maybe, yeah, I think in the future we need to consider that in our research.
Thank you. Appreciate your work. Good luck.
Okay.
Maybe one more question from my side, if there's time. Also, because when you embedded the vancomycin, what do you think how the release is actually controlled?
Sorry to interrupt you, but you're not one of the judges, so it's only the judges who can ask questions. I'm sorry. Okay, is there any judge who wants to ask a question? Okay, Sandal Kamanga, sir.
I think
Yes,
this could be the last question.
I have one question related to your abstract. I look at your abstract, you said the fixed second law was further adjusted and modified to the experimental conditions. Just expand on that.
We could use the mathematical methods to change the formula of the fixed second law, and because every equation could be expressed to several functions. So we could use some mathematical methods to express it, like the Hagrid methods to calculate to solve the fixed second law. And there are also other methods like the domain discretization, and also we could combine the machine learning methods to solve the fixed second law. In this method, we just use a high graph equation to solve the fixed second law.
Okay. Thank you.
Thank you.
The judges can take some time to note their marks and remarks. And thank you,
Thank you.
So you can leave the meeting.
Okay. Bye-bye.
Unfinished marking. Thank you.
Hope all the judges, if once they finish marking, just give a thumbs up.
Good on my side.
Okay, thank you, sir.
I'm done as well.
Tarun, you can start the next presentation.
Okay, so let's move on to the second presentation, which is aging as a stabilizing process for sustainable dissolution enhancement in a career-tailored Etoacon electrospan. This is presentation by Xin Yi from University Science Malaysia, from Malaysia.
Process for sustainable. Hi everyone, I'd like to share about our project on aging as a stabilizing process for sustainable dissolution enhancement in a carrier-tailored Etoacon electrospan. Generally, crystalline materials have a regular molecular arrangement with long-range order and lower aqueous solubility as compared to its amorphous counterpart. In the context of drug delivery, the bioavailability of an active pharmaceutical ingredient is dependent on its aqueous solubility and intestinal permeability as described in the biopharmaceutics classification system. Low aqueous solubility is deemed to be a hurdle in drug absorption as the drug has to be dissolved prior to intestinal permeation. As a rule of thumb, altering the solubility will potentially improve the dissolution and ultimately bioavailability of a drug. In the past, formulation scientists formulated API and polymers to form supersaturated amorphous solid dispersion, which proved to improve the dissolution performance of poorly aqueous soluble drugs. However, this formulation strategy is somewhat of a double-edged sword. For one, supersaturation will deplete over time and undergo phase separation and recrystallization. A previous study proposed that optimizing the hydrophobicity of the carrier system is the key to achieving and maintaining the supersaturated state. However, as an amorphous system remains in a metastable state and is more hygroscopic compared to its crystalline counterpart, the tendency towards phase separation and drug recrystallization during the aging process is high and subsequently might reduce the dissolution performance. Therefore, this study aimed to investigate the performance of supersaturated Etoacon amorphous solid dispersion electrospan system after the aging process. Electrospinning technique was used to produce Etoacon containing electrospan fibers following the reported methodology. Optimized and unoptimized electrospan formulation was selected and subjected to aging study under accelerated condition and dry and temperate conditions. In an accelerated condition, both optimized and unoptimized aged electrospan showed a significant reduction in the dissolution profile compared to the fresh electrospan. Worse still, both the aged electrospan showed lower dissolution profile than the raw crystalline Etoacon powder. The reduction in dissolution profile could be attributed to the moisture absorption-induced phase separation and Etoacon recrystallization. Recrystallization of Etoacon was confirmed to the birefringent intensity increment under the observation of a polarized light microscope. Besides, an average of 22 and 26% drug recovery reduction from their respective fresh electrospan was quantified. The great reduction of Etoacon contained in the aged sample was postulated due to sample weight displacement by the sorbed moisture from the highly humid environment, as PVPVA and PVP generally shows 13 and 40% moisture absorption at 75% relative humidity respectively. This supports the observation of reduced dissolution profile of aged electrospan compared to the raw crystalline powder when taking water weight displacement into consideration. Furthermore, heterogeneity of the sample due to phase separation forming drug-rich and polymer-rich region could also have led to low drug recovery. On the other hand, the dissolution enhancement benefited from the supersaturated electrospan solid dispersion system remained when both optimized and unoptimized formulation was stored under dry and temperate condition. Interestingly, an anomalous sustainable dissolution enhancement was observed in the unoptimized formulation, and that showed a significant enhancement compared to its fresh counterpart. No precipitation of atoichon was observed on the surface of the dissolution medium at the end of the study, indicating solution-mediated recrystallization has been inhibited. Such observation has showed the aged electrospan not only survived the aging study, yet it has transformed into a more stable system regardless of the polymeric system utilized in the formulation. Therefore, despite showing an initial unstable solution-mediated recrystallization, it was suggested that the age factor played a crucial role in improving the stability of thermodynamically unstable amorphous solid dispersion system. The maintenance of dissolution enhancement in aged supersaturated electrospan system as compared to their fresh counterpart could be attributed to the preservation of product amorphicity, drug content, and hydrogen bond interaction formed as evident in differential scanning calorimetry, drug recovery, and infrared studies. Reviewing the dissolution profiles, it was noted that the fresh electrospan undergoes solution-mediated recrystallization during the dissolution study. A similar situation was not observed in the aged electrospan. Therefore, a mechanism for the maintenance of atoichon supersaturation by the annealing effect in the aged electrospan was proposed. The dry storage condition first prevented the possibility of moisture-induced atoichon recrystallization, therefore allowing the amorphous structural relaxation to transform and achieve the equilibrium glassy state during the aging process. As the storage was conducted at room temperature, it was believed that beta relaxation predominantly occurred within the structure of electrospan in the current study. The presence of a hydrophobic component in the carrier matrix was proposed to exert an initial stabilizing effect on the amorphous solid dispersion system, thus no solution-mediated recrystallization was observed in the fresh electrospan. As the structure relaxed, the amorphous solid dispersion was seen to be relatively stable with a lower tendency towards recrystallization upon introduction to the dissolution medium. It was suggested that this annealing process showed a more pronounced effect on the formulation without the hydrophobic component optimization than on the formulation with hydrophobic component optimization. Considering the system has been prior stabilized through the hydrophilic-hydrophobic balance optimization, thus further stabilizing through aging for structural relaxation to sustain supersaturation may not be effective. In the absence of an initial stabilizing effect through formulation optimization, aging was proved to serve as a stabilizing process for the supersaturation effect in the dissolution achieved by structural relaxation. Again, it was emphasized that the duration of aging process may be critical. In conclusion, structural relaxation through the aging process was proposed, which stabilized the amorphous solid dispersion system and prevented desupersaturation, atoichon precipitation at the end of the dissolution study, provided it is stored in a dry and temperate conditions. The presented results suggest an alternative method to stabilize and enhance the dissolution performance of an amorphous solid dispersion system, which was not previously optimized through the formulation design. In the future study, we propose to further elucidate the mechanism of supersaturation maintenance in aged electrospan sample, as it will propose that in this study, that structural relaxation could be the mechanism of atoichon supersaturation maintenance in the aged electrospan sample. Therefore, an in-depth understanding of the relaxation process of the system could be done by characterizing molecular mobility. Techniques such as dielectric relaxation spectroscopy would be ideal to determine the relaxation time and distribution. With that, I end my presentation today and thank you for your attention.
Thank you, Shinji, for that nice presentation. Over to judges for question and answers.
Yeah. Good evening. Thank you. It was a very nice presentation. I just have a very simple question regarding the electrospan process. Did you compare the electrospun samples with simple, I would say, spray dried or simple physical mixture that was dried? And if you saw any difference in the performance, if that control was at all used?
To answer your question, the first thing is in our study, we still yet to try on other spray drying technique or maybe like other solid dispersion method in order to try on this. The particular reason is because the drug incorporated in this formulation is actually a heat sensitive drug. Therefore, we try to find some non-heat invasive methods such as electrospinning and electrospraying. So in our study, we did use electrospraying, which the sample is also shows that after aging it is stable, like the one previously optimized electrospun. Yeah. So
Okay,
it is applicable on both electrospraying powder and also electrospinning film.
Okay. So no simple physical mixture in a solvent and drying as a control was evaluated.
In this study, our control is actually the raw powder and also the normal physical mixture powder with the fresh electrospun film. We didn't use any solvent casting method to prepare the sample yet at this stage.
Good. Thank you.
I have one question. In fact, there are two. The first one has been partially responded to. The critical process variables that you want to highlight for the electrospinning process. You can just give us those ones. And then the second one, in terms of characterization, you've only spoken to light polarized light, to light polarized and also FTIR and DSC. Any ideas or applicability of XRD or Raman to prove the crystallinity of your final products? Any comment on that?
Okay, to answer your first question, Dr. Sandil, so the electrospinning parameters that we have been using particularly affect the outcome of the sample is actually, in our study, is actually the ratio of polymers, which is the PV-PVA to the PVP, because the utilization of different polymer ratio will affect the viscosity of the electrospinning solution, and thus it will affect also on the fiber size, and also later on the solubility. Yeah. So to answer your second question regarding the recrystallization that we realized on the sample which stored under the accelerated condition, so far we didn't attempt to do the X-ray powder diffraction method, analysis on the age sample, but we did on the fresh sample. So for the fresh sample itself is actually for the optimized sample, which is the one with PV-PVA, we actually found that that is a partially crystalline system. But for the unoptimized, which shows a good dissolution after the aging process, the one with PVP only, we actually find during the fresh sample itself is actually fully amorphous. We didn't see any crystalline peak during the XRPD in the fresh sample. But obviously, we can see that from the microscope itself, after aging, both are actually recrystallized. So we completely believe that even though from the polarized light microscope, we already can see there's a crystalline traces. So in XRD, we just have to double confirm again, but we are completely sure that it will achieve. We can obviously see the crystalline peak already later on in the XRPD. But I do agree that XRPD is the golden scale in order to identify the crystallinity of the sample.
One quick question from my side. Thank you very much for your presentation.
Yes, please.
Atobacone is a very poorly soluble compound. Can you clarify why you use non-sink conditions for your in vitro dissolution testing?
The reason why I use non-sync condition is because I want to find out a way to improve the saturated solubility or apparent solubility of the atomic drug itself, because it's too poorly water soluble in order to, when we want to we want to deliver to improve the bioavailability. In fact, the current market's product for atomic is the bioavailability is only at 23%. So in order to improve the bioavailability of the drug itself, we're trying to use the supersaturation method. So to assess whether the formulation is helped, whether the supersaturation strategy, is it useful or not, we try to see from the non-sync condition, because we know that the saturation might deplete over the time. So in order to assess whether it's sustained or not, so non-sync condition is one of the effect, because if we use a completely sync condition, it might be shadowed when we know that it's already sync condition. So impossible that we can see that whether the depletion occurs and the precipitation won't be detected. Yeah,
Okay.
that's the reason why I use non-sync condition in this way.
Very good. Thank you very much. Thank you.
No problem.
This is the last question.
One last
We can have
question.
the question for the next round, because we've had 3 questions in this round.
Okay.
Sorry.
Okay. Only one question, just a quick one, if you don't mind, Doctor.
Shripriya, let each judge has at least one question. There's no issue.
Yes, and we have time.
Thank you.
I'm happy to accept any question. Yes.
Thank
yes,
you. Just one question. I just wanted to know, since this is a highly lipophilic drug, what you have chosen, and it is a BCS class 2, if I am right. And what is the superiority of the electrospinning technique than the available techniques that are the nanoemulsion or microemulsion techniques? Have you compared your technique with the present techniques? That's all I wanted to know.
Okay, so to answer the question, the current available product on the Aftoicon is actually a physical mixture tablet, and also another one is suspension. So the one thing is the physical mixture is obviously the crystalline solubility is really low. So in order to improve it, we're trying to use the amorphous solid dispersion method in our cases, so that we're trying to improve the apparent solubility. So target to improve the solubility itself, and later on, because it's a BCS class 2, no problem with the permeation. So hopefully with the improvement of the apparent solubility itself, we helps to improve the bioavailability. So comparing to why we are not using the suspension or the because some other study previously, they have using the nano suspension or micro particle suspension. The thing is, problem with the particles wise is...
My understanding is, sorry to interrupt you, my apologies, but what I wanted to know, have you compared it in your study? That's all.
So far, to answer you, no, we haven't compared it, because, yeah.
Thank you. Good presentation, all the best.
All right, all right. Thank you so much for the question.
Thank you, Zin. And
so now, judges can take another 5 minutes for recording the scores. Thank you, Shane.
Thank you very much.
Are all the judges done?
Yeah, it's done.
Just hold for a few minutes.
Okay.
Okay. Thank you.
I think now can we move on to the next presentation?
Yes, Tarun.
Okay. So the next title for today is again from DRPI, Japan and Southeast Asia. The topic is role of cell interaction of PLG nanoparticles in the drug delivery life cycle. This is presented by Julia from Mendeleev University of Chemical Technology, Russia.
Hello everyone. Today I'm going to tell you about the role of cell interactions of PLG nanoparticles in the drug delivery life cycle. As you may know, the pharmacokinetics of nanoparticle-based drug delivery systems is generally evaluated by their plasma concentration time profiles. However, the blood partitioning behavior of polylactic co-glycolide nanoparticles, widely used in the formulation of doxorubicin and other anti-cancer agents, showed that a significant fraction of nanoparticles is bound to the blood cells. So they do not appear in plasma, resulting in misinterpretation of pharmacokinetic parameters. Therefore, the objective of the present study was to investigate the influence of cell interactions on the nanoparticle kinetics and tumor distribution. In particular, the nanoparticle interaction and uptake by circulating immune cells, such as monocytes and neutrophils, the so-called cellular hitchhiking, was suggested to play one of the key roles in nanoparticle deposition. For this purpose, intravital microscopy was used. For the visualization of both nanoparticles and released drug, doxorubicin, the nanoparticles were covalently labeled with Cy5 fluorescent dye, so that the fluorescence emission spectra of Cy5 could be well distinguished from that of the doxorubicin. Taking into account that drug release profile may significantly alter nanoparticle parameters as well as targeting capability, 3 different fluorescently labeled PLG nanoparticle prototypes were prepared. The so-called fast-releasing formulation and formulation with medium release, obtained by varying the pH of external aqueous media during nanoparticle preparation, and slow-releasing formulation obtained by the addition of counterion during nanoparticle synthesis that increases the retention of doxorubicin in polymer matrix. All nanoparticle prototypes exhibited an average size around 100 nanometer with slightly negative zeta potential. The drug release profile in vitro was investigated using two different techniques. The first one was performed using a simplified release media and a centrifugation method to separate nanoparticle-bound doxorubicin fraction, and the second one using dispersion releaser technology with a donor and acceptor compartments and medium replacement. The amount of the released doxorubicin was quantified using HPLC. Both techniques indicated a considerable burst release for fast-releasing formulation, the green line on the first and the second graph, while a prolonged release phase and lowered burst effect was observed for the medium release and slow-releasing nanoparticle systems. In the current investigation, the doxorubicin and PLG fluorescence signal in the blood vessels and tumor region were monitored using intravital microscopy. Intravital microscopy is a powerful optical imaging technique for collecting dynamic data in vivo with high spatial resolution. In the present study, the 41 adenocarcinoma cells were subcutaneously implanted to biopsy mice, and real-time imaging was performed 10 days after tumor inoculation using inverted laser scanning microscopy and skin flap technique. Here you can see the nanoparticle distribution in the blood vessels after intravenous injection, and doxorubicin that is gradually released from the nanoparticles and accumulated into the cells of the peritumoral space. You can also observe it on the images below. The visualization of nanoparticle interaction with immune cells was performed after the injection of fluorescently labeled antibodies to stain immune cells such as monocytes and neutrophils. On the left 3D reconstruction, doxorubicin accumulation in the cell nuclei is well distinguished. You can see neutrophils on both images into the blood vessels, and the areas of nanoparticle extravasation, the areas of macro and macro leakage formations for PLG nanoparticles. Approximately 15 minutes after the injection, the unspecific adsorption of the nanoparticles to the blood cells, red blood cells in particular, is followed, replaced by their redistribution to the immune cells that are able to capture nanoparticles and mediate their trafficking across the vessel wall to the tumor site. The tracing of neutrophils colocalized with doxorubicin-loaded nanoparticles highlights that nanoparticles were effectively accumulated by the neutrophils, the outlined regions of interest, and transported across the vessel wall. You can see this tracing in time and the corresponding video. The quantitative analysis of nanoparticle uptake by immune cells was performed by flow cytometry. The association of nanoparticles with subpopulations of blood cells was determined for both drug-loaded and placebo nanoparticles. Indeed, nanoparticle redistribution to the monocytes and neutrophils was observed starting from 15 minutes after injection and was increasing with time. To confirm the localization of nanoparticles in neutrophils and monocytes, confocal microscopy was used. It confirms that 30 minutes post-injection, a significant amount of nanoparticles has entered the immune cells. You can see nanoparticles right inside neutrophils. The circulation of nanoparticle prototypes was monitored for the first 45 minutes after injection by intravital microscopy. The extravasation through the tumor vessel wall via micro and micro leakages were detected for all nanoparticle types, enabling doxorubicin delivery to the cell nuclei, its target site. The corresponding video you can see on the right. The leakages were characterized by their area, number, and spatial distribution. The profile of doxorubicin accumulation in the tumor area was assessed for 3 nanoparticle types. The significant difference in nanoparticle half-life were detected. You can see that fast-releasing nanoparticles half-life was about 80 minutes. That is significantly lower than for medium and slow-releasing nanoparticles. Moreover, it was determined that fast-releasing nanoparticles subsequently undergo agglomeration once entering the blood circulation, followed by their fast elimination. At the same time, all 3 nanoparticle types exhibited a similar mechanism of extravasation and distribution across the vessel wall to the perivascular space. To sum up, the nanoparticle uptake by immune cells appears to be an additional and very important phase in the nanoparticle drug delivery life cycle. Moreover, the medium-releasing PLG nanoparticle formulation appeared to be more stable in the bloodstream and exhibited a higher initial drug loading. Therefore, this formulation can be considered as an optimal formulation for nanotherapy. With this, I'd like to thank you for your attention.
Thank you, Julia, for that wonderful presentation. Over to judges for question and answers.
I have one question, to just a straightforward one. Ethics approval for studies of this magnitude, just speak to us in terms of a committee that approved the study, the Animal Ethics Committee.
Thank you for the valuable question. We performed all animal studies in the University of Psychiatry of Russian Federation, and this technique was first performed by our colleague from Calgary University. He then moved to Russia and taught us intravital microscopy. So all animal work was approved by ethics committee of those University of Neural Psychiatry of Russia. And all nanoparticle formulations were synthesized and characterized in vitro based on the Mendeleev University of Chemical Technology. Anyway, I just want to add also that we also mentioned that this technique, because we allows us to collect maximum information from one animal, not to use like a great group with 10 animals, but those lifetime imaging allows us to visualize those dynamic processes from the nanoparticle entering of the bloodstream and then their redistribution to one type of cell, then to specific redistribution to the immune cells. So one of the main ideas here was also to minimize the number of animals on preclinical studies. Thank you.
Yes.
I have one question. Please, can you go to the slide number 3? Slide number 3. I think it is method 1 and method 2.
Sarun, can we go to slide number 3?
Method 1.
Yes.
Yeah, just hold on.
Just a minute.
Is it this?
No, it's written, it's listed as method 1 and 2. I think it's next.
You mean the release profile, yeah.
After this, next one. Yeah, this one. Sorry. Yeah, I'll keep it here. Yeah, just I need the one at the bottom, the release of you can get that in. Yeah, there is something called in method 1, there is written as spectrophotometry. And then on the method 2, you have written HPLC. Now, what is the comparative? What kind of spectrophotometry was done? And the other method is by HPLC. So how is it comparable?
Thank you for the question. Yes, we used both techniques. The first one using the centrifugation to separate the unbound drug fraction and doxorubicin that is still bound to the nanoparticles. And we used Shimadzu spectrophotometer. And the second one was the classic pharma-test dispersion releaser. With the donor and acceptor compartment and the dialysis membrane. We also performed HPLC for quantification of the doxorubicin content when we characterized our nanoparticle batches, prototypes, their reproducibility of the methods. Both techniques indicated the same tendency, the same trend in nanoparticle release profile. We used the first one for long-term release and the second one especially to understand what is happening within the first minutes, because these minutes were most important once we understand that in general, our nanoparticles are not stealth-coated, so they blood circulation half-life is not so long. But we did observe that they are effective, that they showed anti-cancer activity. So the idea was to understand what mechanism impact this high activity, the ability to deliver drug to the tumor. So those first minutes were
my interest in asking this question is, if you have done method 1 by UV spectrophotometry, from what I assume you have used the Shimadzu spectrophotometry, and the method 2 you have performed it by HPLC, would it be a difference in limit of quantitation or limit of detection? So that is what I am trying to understand.
Yeah, limit of detection for the first method, the calibration curve was from let me say 1 microgram doxorubicin to 100 micrograms or so on. Anyway, we used the concentrations that were comparable with our in vivo studies. So it was like 5 milligram of doxorubicin per 1 kilogram of mice. And we trying to understand those values of doxorubicin concentration upon dilution. And the main idea here was just to understand the trend. So the trend that the fast-releasing nanoparticles had very significant burst release was the most important for us right now.
Thank you. Good work. Keep it up.
Thank you.
Yeah. Good afternoon. Good evening. Julia, very good presentation. Thank you. I have two questions. Number one is on the same slide, slide number 3. What was the reason to use 1% poloxamer P188 as a surfactant? Because you use that for your release media. And number 2, when you look at the slide number 3 versus the in vivo distribution data, which you have shown in the end, in the slide 3, we see very distinct and significant variation between the 3 formulations, fast, medium, and slow. But when you look at in vivo data, there is a lot of variability. There doesn't seem to be any correlation there. So I just wanted to see what are your thoughts on these 2 questions.
Thank you for the question. For the first one, we used poloxamer 188. One reason to use, the main reason to use it here was the stability of the release media, because we monitored the doxorubicin release for 72 hours to 1 week in this method. And also poloxamer 188 is supposed to mediate the surface of nanoparticles to enable its delivery across the blood-brain barrier and tissue barriers, because it mediates the protein corona that is formed on the nanoparticle surface once entering the bloodstream. So these surfactant on the nanoparticle surface is of particular interest for us. But the main reason here in the release studies, in vitro release studies, was to increase the stability of the released drug from its precipitation, doxorubicin, and to monitor the long-term release of the drug. And concerning the in vivo investigation, first of all, we investigated as biodistribution for nanoparticles, for PLG nanoparticles, for particle-bound doxorubicin and unbound doxorubicin. And there were several fractions like a nanoparticle-bound fraction and free fraction that is released from the nanoparticles. It was modeled using in silico biodistribution model. And if we speak about these results of this experiment, interesting that fast-releasing formulation tend to agglomerate within the first minutes, tend to aggregate once entering the bloodstream, possibly due to that much amount of the doxorubicin on the nanoparticle surface. So the elimination of this nanoparticle type was faster. That's why we could see those half-life around 8 minutes. But it was calculated based on the average fluorescence intensity of PLG nanoparticles into the bloodstream from the regions of interest that were selected from the blood vessels of different diameter, and then calculated using these elements of TWE of the microscope. But if you're really interested in it, I can supply some additional information, because maybe I have to not draw it, or some schematic representation of it will be more necessary here.
Sure, thank you. I appreciate it.
But this study is still in progress, so.
Thank you.
Thank you.
Judges can note their.
Do we have time just for one quick question? Yeah. Thank you for your presentation. Just can you share some of your thoughts? Because you mentioned that in vivo, there are some indications that the product is migrating within 30 to 55 minutes, I think. And your two methods in vitro are showing profiles over very different time frames. So a few minutes with the disperser and 40 to 50 hours with the centrifugation. Can you share some thoughts about any possible correlation between in vitro and in vivo?
Briefly, please brief.
Very briefly, yeah. Sorry.
Very briefly. We also performed modeling of in vitro and vivo correlation, and we determined that in our previous studies that nanoparticles, such type of nanoparticle with different release profile, possess different targeting capability, the ability to deliver doxorubicin to the tumor. It is already published in our previous results, and we did observe that nanoparticles with medium release have higher targeted capability compared to nanoparticles with a fast release. That's it. I can add the reference to this publication.
Okay, thank you.
Thank you.
Thank you.
Thank you very much for the wonderful event. Thank you.
Judges, you can note down your marks and remarks.
Yeah.
Thank you, Julia.
Thank you.
So our next presentation is again from DRPI, Japan and Southeast Asia. The topic is understanding the structure-release relationships of Cepinho. This presentation is by Aika Alte-Benetti from National University of Singapore.
Hello everyone, I'm Aika Alte-Benetti. Today I'm here to talk about the structure-release relationship of Cepinho. The aim of this work is to provide a true examination of the impact of pH and ionization status of an IP loaded in Cepinho, and then to investigate the release and viscoelastic profiles. The reason why we are going through this investigation is that there is a gap in literature about IP ionization effect, rheology properties, permeation and in vitro release profile of semi-solid preparations. We choose Cepinho because of its self-jailing properties via its dispersion of polymer matrix in isohexadecane as the oily continuous phase containing polysorbate 80 as a stabilizer. And we choose diclofenac sodium because of its ionization range, considering its pKa value is 3.84. Here is the outline of the experiments. The formulation were prepared at pH 2.55, 5.55, 7.4, and 11.56. The dose of IP dispersed as 0.1%, 1%, and 0% of diclofenac in 3% of Cepinho gel. After the preparation of Cepinho gel formulations, we perform an investigation on rheology properties together with physicochemical characteristic analysis, in vitro release profiles, and ex vivo skin permeation profiles using pig ears. According to amplitude swap of analysis, all across formulations, blank and 0.1 of diclofenac loading have the crossover point, which is when G prime and G double prime at a shear strain of 30 to 32%. Storage model of diclofenac gel formulations increase when pH increasing from 2.55 to 7.4. However, 1% of diclofenac formulations, no matter at what pH, show the same elasticity, and usually the elasticity of gel drops with the diclofenac dosage. G and G double prime at shear strain of 20 to 33% were detected when 1% of diclofenac loaded into the formulations. On the other hand, blank and 0.1% diclofenac formulations at pH 11.56 showed lower elasticity compared to the other formulations. This observation of frequency swap is similar to the measurement of amplitude swap, although blank and 0.1% formulations has the same parallel behavior of G prime and G double prime with an incremental amount of diclofenac. G prime and G double prime value decrease as the amount of diclofenac increases in the formulation. Crossover points were where G double prime major than G prime is only observed for 1% of diclofenac at pH 2.55. The flow swap was carried out, and the viscosity of gel formulation decreases when the incremental amount of diclofenac was added into the Cepinho gel formulations. Even though the amount of IP changes the behavior of gels, changing the pH levels didn't lead any statistically significant difference in viscosity values. On the other hand, the static contact angle measurement showed that the blank and 0.1 formulations have a pH-dependent behavior. This observation reached the same conclusion of amplitude swap analysis. The surface tension increases when diclofenac increases. However, there is not any significant difference detected between 5.55 and 7.4. Those are the pictures of loaded Cepineo gel with 0.1% diclofenac and taken with both polarized light and bright field light. Diclofenac in acidic buffer crystallize when at lower loading value, that is 0.1%. Diclofenac at the same concentration dissolved
Arun, there is a
we cannot see any crystallized
Tarun,
in this
what we are hearing and what we are seeing is different.
Here is the 1% of diclofenac.
From last two slides.
You can go back a little. Thank you.
The pH levels didn't lead any statistically significant difference in viscosity values. On the other hand, the static contact angle measurement showed that the blank and 0.1 formulations have a pH-dependent behavior. This observation reached the same conclusion of amplitude swap analysis. The surface tension increases when diclofenac increases. However, there is not any significant difference detected between 5.55 and 7.4. Those are the pictures of loaded Cepineo gel with 0.1% diclofenac and taken with both polarized light and bright field light. Diclofenac in acidic buffer crystallize when at lower loading value, that is 0.1%. Diclofenac at the same concentration dissolve better in basic buffer. You cannot see any crystallized in this formulation. Here is the 1% of diclofenac loaded into the gels, and you can see the crystal shape of diclofenac in which all pH. To evaluate the morphology of gels, lyophilized samples analyzed via scanning electron microscopy. As you can see, the shape of the microstructures are very different among all samples, while diclofenac crystals are very visible at lower pH. Diclofenac gel actually, the Cepineo gel becomes stiffer with increasing values of pH, while the diclofenac loading reduces the microstructure of Cepineo gels. A molecular dynamic simulation showed that the diclofenac is usually on the surface of isohexadiene aggregates with a negligible effect on the size of aggregates. At acidic pH, diclofenac forms bigger droplets together with isohexadecane. But a certain amount of ionized form is not stabilized by polysorbate AT. When the diclofenac is ionized at higher pH, acrylamide interaction with the polysorbate became lower, and while its reaction with isohexadecane became stronger. The partition studies were performed using different ratio of polysorbate AT, 0.1 and 1% of isohexadecane in aqueous solution. Diclofenac is retained into the filter at lower pH because the lack of ionization leads to a slow solubility and its crystallization. Diclofenac in vitro release was very slow at lower pH, with a marked increase when the pH of the medium goes above pKa of the drug. Cepineo actually proved to be more effective in controlling the drug release. Ex vivo permeation study showed that the drug permeation is comparable for both gels but it also highlights the pH effect. The higher permeation obtained at pH 5.55 and 7.4 with or without polymer. This can be explained by ionized diclofenac molecules' affinity for specific receptors and transports, while the high pH around 11.55 wrecks the receptors. That's why we see low permeability. Further permeation tests, according to the recovery of diclofenac, show that the drug absorption through the skin is affected by pH, but also by the interaction between the drug and the polymer itself. Polymer helps the permeation of ionized drugs at pH 7.4, while the formulation at 2.55 without any polymer permeates more than other formulations. We prove that the formulation pH significantly affects drug release, permeation profiles, while there is no effect on rheological properties when the formulation is loaded with incremental amount of diclofenac. Thanks to this work, it will be possible to optimize drug release and permeation of other IPs from the semi-solid preparations. Thank you so much.
Thank you, Aika. You may please start your video. And judges, you may please start with question and answers.
Hello, thank you.
Yeah, good afternoon, good evening. It's a very good presentation. Thank you. I just have a very simple question. What was the reason to select the diclofenac sodium, which has a pH-dependent solubility for this evaluation?
Yeah, actually, what also I discussed at the beginning of the presentation, we would like to understand the ionization effect of this drug. So that's why we wanted to select this diclofenac to evaluate the pH effect. Also, any kind of interaction with Cepineo, since Cepineo is available on the market and you can find easily to prepare self-assembling the gels. Yeah.
Okay, thank you.
Thank you.
Yeah, thank you very much for your presentation. So you are clearly demonstrating that pH is critically affecting the drug release. What about stability testing? I mean, in that case, usually during stability testing, we pay a lot of attention to degradation and so on. But here, the release and maybe the bioavailability may be affected by changes in the pH. Did you evaluate how the pH of your formulation, this Spinel, how stable is the pH over stability?
Yeah, actually, we did this pH stability over 1 month to be sure that actually for the rheology properties. So we want to understand whether the rheology properties change over a period, so that pH also changed as well. We didn't see any kind of change because since Cepineo is a kind of polymeric matrix also affect the pH. So once we actually what we see is that in acidic condition diclofenac crystallized. So we are assuming that this crystallization affect also the rheology. That's why we see a lower elasticity at lower pH. But once we go through above the pKa value of diclofenac, actually Cepineo and diclofenac have more robust combination. So in terms of the stability beside rheology and then FTIR, and DSC, TGA, we actually didn't see any significant difference between pH. Yeah.
Okay, thank you.
Yeah.
No, good presentation, good work, lot of effort there. I just wanted to know, since the question that I thought of asking was asked by the previous guest, I just wanted to know what, based on the study, pH being so important, what could be the effect if diclofenac sodium was replaced by diclofenac potassium or diethylamine?
Yeah, this is also a good question. This is one of the suggestions I did also to Pfizer. I would like to evaluate the salt effect on this purpose. So it will be a nice idea to see diclofenac potassium and diclofenac sodium permeation. And I know that there aren't so much research in the literature for that. So probably if the company is still interested in, I would like to go on for that, because I know that salt effect can also affect ionization. So probably the release profile and then rheological properties as well.
So just a follow-through question. There are two Spaniard gels. No, one is 600, one is Derl. There are two in the market. Which one did you use?
We use diclofenac sodium.
No, the gel, the polymer.
The polymer is Cepineo. It's already
600 or Derl. I mean, there are two polymers. 600, the trade name.
P600. Sorry.
Okay, thank you.
You're welcome.
Good presentation. All the best.
Thank you so much.
Okay. Are the judges done with the questions? So you can take time to, note down your marks and remarks. And thank you, Aika.
Thank you so much.
Thank you so much. If all the judges are done with the evaluation, we can proceed. Everybody is done? Okay. Dr. Sandeep Tiwari?
Yeah, Dr. Tiwari is done.
Okay.
So we move on to the fifth presentation in the series. This is coming from DRPI India. This is titled Amphotericin B Nanoformulation Insta-AMB Tracking Safer Monomeric AMB Release. This presentation by Pooja Todke from Institute of Chemical Technology, Mumbai, India.
Namaste. Greetings to all reviewers. My name is Pooja Todke, a PhD research scholar from Institute of Chemical Technology, Mumbai, presenting research entitled as Amphotericin B Nanoformulation Insta-AMB Tracking Safer Monomeric AMB Release. As we all know, amphotericin B is a gold standard for the visceral leishmaniasis, and the first conventional AMB therapy exists in aggregated AMB, and which is non-specifically interact with the human cholesterol. This results in a liver and fetal kidney toxicity. To overcome the toxicity issue, lipidic AMB nanotherapy came into picture, which exists in superaggregated AMB, which is also called as a monomeric depot because it releases the monomeric AMB and which is specifically interact with the fungal ergosterol, which significantly decrease the toxicity. Nevertheless, there are many challenges are associated with lipidic AMB nanotherapy. Therefore, we present Insta-AMB, a safer amphotericin B nanotherapy prepared by Facile Technology. Insta-AMB development was initiated with the screening of lipids using molecular operating environment software. For a molecular docking study, we were selected various fatty acids containing excipients from a shorter to longer. As you see on the left side, the shorter fatty acid containing excipients reveal an incomplete wrapping, proposes the aggregated AMB. While on the other hand, longer fatty acid containing excipients reveal a complete wrapping, which proposes the superaggregated AMB. Further, we are demonstrating interaction of Insta-AMB with the cholesterol and ergosterol using molecular dynamic simulation. Insta-AMB lipid complex, and we have used control as a liposomal AMB and aggregated AMB, which are simulated with the cholesterol and ergosterol respectively. And the result demonstrated that Insta-AMB lipid complex does not interact with the cholesterol, which is comparable with the liposomal AMB, and a significant interaction was observed with the ergosterol. However, in the case of aggregated AMB, revealed a significant interaction with the cholesterol, and with ergosterol revealed a limited interaction. After selection of novel lipid, Insta-AMB were prepared by using an in situ nanotechnology. Insta-AMB is an example of technological breakthrough. Insta-AMB is a pre-concentrate. It is a simple solution of AMB plus excipients in a pharmaceutical acceptable solvent. At the patient side, while administration, Insta-AMB is withdrawn using a syringe and is simply added into the dextrose injection, which results in the instantaneously generation of AMB-loaded lipidic nanoparticles. Now, Insta-AMB is ready to inject. More than 95% is AMB in trap, TAM revealed, size about 80 nanometer and PDI 0.340. And importantly, Insta-AMB revealed super aggregated state of AMB. The objective of the present research, a very novel application of dissolution testing in a tracking safer monomeric release from Insta-AMB by using UV spectroscopy. And the principle behind is, as you see, UV spectrum showed the peak 1 between 321 to 325 for the super aggregated AMB, peak 2 between 330 to 350 nanometer for aggregated AMB, and a third peak between 405 to 450 nanometer for the monomeric AMB. For in vitro release of Insta-AMB, we have used two dissolution apparatus, USB2 and USB4. These are the conditions followed for the dissolution study. We perform dissolution in a 2 biorelevant media. Since it is an intravenous nanoformulation, we have used simulated intravenous parental medium, that is Krebs Ringer buffer pH 7.4 with the 4% albumin. And second medium, since Insta-AMB is targeted to the intracellular infectious diseases like a visceral leishmaniasis, for that we have used simulated intracellular lysosomal biorelevant medium, that is artificial lysosomal pH 4.5 with a 0.2% Win20. And liposomal AMB nanoformulation was used as a reference. Coming to the major objective of the research, that is tracking of monomeric release. In the USB2, a low release was observed in the KRF and very high standard deviation was observed in the KRB as well as in the ALF. In the ALF media, a rapid release was observed, and which is important for the intracellular infection like a leishmaniasis. Coming to the tracking by the UV spectroscopy at the initial time points, that is 10 minutes, Insta-AMB and liposomal AMB revealed a super aggregated AMB peak. Then over a period of time at a 6 hour in a dissolution media showed a decrease in the super aggregated peak with increasing the monomeric peak. Tracking of monomeric release in USB4 apparatus. Compared to the USB2, you showed the complete release was observed in a KRB as well as in an ALF, and also low standard deviation was observed. Similarly, USB2 in a USB4, the faster release was observed in the ALF as compared to the KRB, which confirmed the augmented intracellular drug release. FT value more than 50 indicated that Insta-AMB, which is comparable release profile with the marketed liposomal AMB. Likewise, tracking of USB2 release, USB4 revealed a super aggregated peak in the Insta-AMB and liposomal AMB at initial time points in a dissolution media. Over a period of time, in both biorelevant media revealed an increase in the monomeric peak, which confirmed that super aggregated AMB would serve as a monomeric depot. Overcome the toxicity of amphotericin B is a biggest challenge, and importantly, as a demonstrated safer monomeric release, further safety evaluation of Insta-AMB is necessary. For that, we have performed in vivo zebrafish toxicity study. OECD 2.0 guiding protocol we have followed. Danino rerido zebrafish incubated with a different concentration containing the AMB nanoformulation, and the mortality was recorded up to 96 hours. Toxicity results demonstrated that a 10-fold higher LD50 of Insta-AMB compared to the aggregated AMB confirmed the enhanced safety. Similarly, the safety also confirmed by hemolysis study. Insta-AMB showed less than 15% hemolysis, which is comparable with the gold standard liposomal formulation. And in the case of aggregated AMB micellar formulation, showed at a lower concentration 100% hemolysis. So the low hemolysis propose a safety of Insta-AMB. Coming towards the anti-leishmaniasis efficacy. For that, we have used infected microphage cell line with a luciferase transfected Leishmania donawani bromastigotes that converted into the amistigot. Then Insta-AMB and standards were incubated for 72 hours and luminescence was measured. And results demonstrated that that's 11.22-fold lower IC50, 3-fold lower CC50, and thereby 3.66-fold higher selectivity index compared to the standard, which confirmed the superior efficacy coupled with the safety of Insta-AMB. I would like to conclude. We demonstrate in vitro dissolution testing as a practical and a useful tool to predict the AMB nanoformulation safety. Thank you by saying Insta-AMB, ensuring safety through monomeric AMB release. I would like to acknowledge my research supervisor, Professor Padma V. Devarajan, and Mr. Sukumas Evle. I'm very thankful to Sodax India Private Limited for USB2 and USB4 apparatus. Thankful to Cipla Private Limited for a gift sample of amphotericin B. Thank you so much.
Thank you, Pooja, for that presentation, and sorry for the interruption. Over to judges for Q&A.
Pooja, can you put your video on? Thank you. Yes, Kamanga, sir.
Yes, I'm happy to start as well. And in terms of your zebrafish studies, and we were not told at what stage in terms of it was zebrafish embryos up to a certain period. So the question really leads to ethics clearance around that. I know you don't need them for a period of less than 120 days. So that's the first one. Then the second question is, how did you confirm safety by evaluation of super aggregate states? I just didn't get that part. Just educate us on the two parts. Thank you.
Thank you so much for your question, sir. The first question, we have used adult zebrafish, the weight from the 0.2 and to 500 mg of the zebrafish. And the second question, that the safety of the super aggregated AMB, because in the aggregated AMB, it is also called as a dimer. It is affinity towards the cholesterol as well. But while in the case of monomer, it is also called as a super aggregated, also called as a monomery depot. It slowly releases monomer, and the monomer higher affinity towards the ergosterol, or it specifically interact with the ergosterol, not to the cholesterol.
Yes.
Sorry, I was muted. Any specific reason why you did not try kidney cell lines? Because the safety, as you rightly pointed out, it's mainly the renal one. And
Yes.
I was just trying to follow that.
Yes, we have performed the very popular model, that is zebrafish, is for the toxicity study. For that purpose, we have tested against the zebrafish, because the major concern of amphotericin B is a toxicity. So the popular model for the toxicity study of any drug product is zebrafish. So your suggestion for the to check against the kidney cells is very good. We will going to perform that. Thank you, sir.
Dr. Sandeep Tiwari.
Yeah, thank you, Pooja. Good presentation.
Thank you, sir.
I just have a question on your slide number 10, where you have showed that the LD50 of Insta-AMB is lower, I think significantly lower than the liposomal AMB. However, all other safety parameters are equivalent for liposomal AMB.
Yes.
What is your comment? What is your comment on that?
Yes,
and
sir.
why you think like you have that kind of a performance?
Our Insta-AMB formulation containing only one lipid, and in liposomal AMB, it is a lipidic bilayer system. So it is a more safer as compared to Insta-AMB as well. But we are greater than the aggregated AMB, that is 10-fold higher. So we are in the range of the safety. So the liposomal AMB is unaffordable to the lower economic strata. So that's why because the phospholipids they are containing the hydrogenated soy-lecithin as well as the DSPG. These are very expensive phospholipids. So in the Insta-AMB, only one lipid is present, and which is very cost effective. And it is also approved in the FDA by intravenous.
Okay, thank you. So your focus is mainly to make it affordable, right?
Yes, affordable and the safer as well.
Thank you.
Quickly, thank you for your presentation. You tested your product, your formulation with both paddle and flow-through cell. And you mentioned that paddle is showing larger variability in the individual profiles. Can you elaborate on what is your understanding on why we see such difference?
Because in the USP2, the hydrodynamics is different, and in the case of USP4, this is a flow-through system. In the USP2, the hydrodynamics is highly heterogeneous. In the upper part of the vessels is different, the mixing, and in the case of USP4, there is a homogeneous, and the flow-through is another mechanism is that is simulating the in vivo condition of the, since it is an intravenous formulation. So this is a more proper, and because of the hydrodynamic difference, this variability was observed in the case of USP2.
Okay, thank you. Thank you. That's it from my side.
One question, good presentation and very impactful research, of course. My interest is in method B. You have used sterilization by filtration using 0.22 micron filter. Now, my question is, what kind of membrane filter you use? And secondly, have you validated that process?
Yes, we have used the compatibility study we have done with the different filters. So the nylon is more compatible, and the Teflon filter is more compatible according to drug content. So we have go for this membrane filtration for the sterilization, we have used 0.22 micron nylon filter.
So I presume both drug was available in complete concentration and also
Yes, more than 95% was drug content was observed. 5% loss was observed in the nylon filter.
So you performed validation of that.
Yes, yes.
Good. All the best for your research. So hopefully your product will be out.
Arun?
Yeah.
We can,
So-
as the judges mark, we can
Correct.
have the advertisement. Pooja, thank you.
Thank you, ma'am.
I believe all the judges have completed their evaluation. So we'll take a break of 4 minutes. We'll come back at 7:25 Indian time. So another 4 minutes.
Tarun, we can give at least 10 minutes break, please, for the judges especially.
Okay. All right.
10 minutes break. Thank you.
Thank you, appreciated.
insulation, cosmetics, diapers, running shoes. These products could not have been made if not for BASF Antwerp. It's the second largest production site of German chemical concern BASF. Our 50 production plants make essential raw materials for virtually all processing sectors, from pharmaceuticals and hygiene products to the automotive industry. The site of BASF Antwerp is about the size of Antwerp's city centre. It's located at the heart of Europe and well connected to rail, road, waterways and pipeline networks. Our key operating principle is Verbund. All our plants are interconnected, meaning that the end products of one production plant serve as the raw materials for another. This way we generate less waste and need less transport and energy. For example, to make diapers superabsorbent, boats supply our steam cracker plant with naphtha as a raw material, which is then converted into propylene. Propylene is then processed into acrylic acid. Acrylic acid is the raw material for superabsorber used in diapers. Ensuring a safe working environment for employees and neighbours is priority number one. Every day, our more than 3,000 employees combine their expertise, knowledge, drive and creativity to make sure our plants run safely and smoothly. At BASF, we keep innovating for a sustainable future. We create chemistry. Insulation, cosmetics, diapers, running shoes. These products could not have been made if not for BASF Antwerp. It's the second largest production site of German chemical concern BASF. Our 50 production plants make essential raw materials for virtually all processing sectors, from pharmaceuticals and hygiene products to the automotive industry. The site of BASF Antwerp is about the size of Antwerp's city centre. It's located at the heart of Europe and well connected to rail, road, waterways and pipeline networks. Our key operating principle is Verbund. All our plants are interconnected, meaning that the end products of one production plant serve as the raw materials for another. This way we generate less waste and need less transport and energy. For example, to make diapers superabsorbent, boats supply our steam cracker plant with naphtha as a raw material, which is then converted into propylene. Propylene is then processed into acrylic acid. Acrylic acid is the raw material for superabsorber used in diapers. Ensuring a safe working environment for employees and neighbours is priority number one. Every day, our more than 3,000 employees combine their expertise, knowledge, drive and creativity to make sure our plants run safely and smoothly. At BASF, we keep innovating for a sustainable future. We create chemistry.
Welcome back. I hope everyone had a nice break. And we can proceed with the next presentation. Is Krishnapriya ma'am back? Okay. So the next presentation is titled Four-Dimensional Printed Construct from Thermoresponsive Self-Folding Feedstock for Pharmaceutical Applications. This is presented by Purushottam Suryavanshi from Naipar, Guwahati, Assam, India.
Good afternoon. So myself Purushottam Suryavanshi. So today I am here to present my research work entitled Four-Dimensional Printed Construct from Temperature Responsive Self-Folding Feedstock for Pharmaceutical Application under the supervision of Dr. Shubham Banerjee, Associate Professor, Department of Pharmaceutics, Naipar, Guwahati. So coming to the introduction, so basically what is 4D printing? So the 4D printing is nothing but the advanced version of 3D printing technology where the smart materials known as shape memory polymers are used to prepare a prototype which have ability to change its shape with respect to the external stimuli such as pH, temperature, magnetic field, IR radiation, and hence emphasizing a time as a fourth dimension. So coming to the rationale of our work, so nowadays pharmaceutical scientists faces new challenges in terms of designing a novel dosage form due to a poor dissolution profile, poor patient compliance, poor drug release with respect to the subject need. So they are finding a new ways to design or to formulate a new dosage form. So nowadays a 3D printing technology, which is an emerging technology which come in a pharmaceutical field, which have ability to customize a dosage form with respect to the patient need, and its advanced version, that is a 4D printing technology, has the ability to change to monitor the drug release with respect to the body physiological condition, and the customization of the dosage form is also possible using 4D printing technology. So considering all the discussed points, the rationale of our work is to explore first time specifically in India the 4D printing technology in drug delivery system, so that we can modulate the drug release with respect to the body physiological condition, and hence improving the dissolution profile, patient compliance, and personalization of medicine with respect to the subject need. So this is the experimental approach of our work. So the experimental approach is divided into two parts. That is, the first is the synthesis of a novel shape memory material, and second is its integration extrusion into 3D printing technology to form a 4D printing technology. So here we use n isopropyl acrylamide as a temperature responsive material and 4-acryloxybenzophenone as a self-folding material, and the new shape memory material, that is a PNIPAM 4ABP, was synthesized. Further, we converted that PNIPAM 4ABP matrix into a gel, and we used semi-solid extrusion based 4D printing technology to form a 4D construct. And further, we evaluated all the 4D printing construct in terms of shape fixity, shape recovery, shape memory behavior, further its in vitro drug release, and then such characterization such as NMR, FTR, mass, DLS, rheology, DSA, and XRD technique. Here we use paracetamol as a model drug. Next, coming to the findings. So here we characterize the synthesized material using various tools such as H1NMR, C13NMR, FTR, spectroscopy, and all. So we found that, so the data found successful synthesis of the new shape memory polymer. So here further we used the LCST measurement, we determined the LCST of our shape memory polymer. So here we used DLS, that is a dynamic light scattering technology, to find out the LCST, and the LCST was found to be around 27 degrees Celsius, which means that below the 27 degrees Celsius the shape memory material shows a folding type behavior, and above the 27 degrees Celsius it shows the unfolding type behavior. So coming to the physico-technological characterizations, so before going to the semi-solid extrusion 3D printing technology, we have to convert the polymer matrix into the gel matrix, and we converted the polymer matrix into the gel matrix using acetone and PEG solvent system. And further we integrate paracetamol as a model drug within the gel matrix, and we analyze the rheological behavior of the both placebo and paracetamol loaded gel, and the data confirm there is no effect of paracetamol on the gelling characteristics of the PNIPAM 4ABP gel, and which is suitable for the 3D printing technology. Further, to assess any interaction between paracetamol and the polymer matrix, we perform the Raman spectroscopy, and the obtained data confirms there is no interaction between polymer and paracetamol. So coming to the solid state characterization of the PNIPAM 4ABP placebo 3D construct and paracetamol loaded 3D construct. So the obtained data confirms complete amorphous conversion of paracetamol within the gel matrix, and there is no interaction between the polymer and drug. So coming to the FTR and same analysis, so to go into the molecular level understanding of the shape memory behavior of the synthesized material, we perform FTR spectroscopy at different temperature, and the obtained data confirms the carbonyl group of the 4-acryloxybenzophenone and PNIPAM is responsible for the shape memory behavior. And further, to go into the molecular level understanding, we perform same at various temperature, that is A figure shows the like permanent shape, B shows that the prototype which is kept above the glass transition temperature, and C is a recovered prototype. So from A, B and C we can see in B, when the prototype is kept above the glass transition temperature, we can see the large pores which is due to the deformation of polymeric chain, and in C we can see the polymer chain mobility gaining its mobility and recovered to its original shape. So confirming the molecular level behavior of the shape memory polymer. So next, coming to the main part of our experiment, that is a shape fixity and shape recovery behavior. So to assess the shape memory behavior of our polymer, we use a shape recovery parameter. So here we immerse the initial prototype or initial shape into the water bath, which is maintained at a 50 degrees Celsius to give a temporary folded shape. Further, the temporary folded shape was fixed by freezing it below the glass transition temperature. After the shape fixation, we re-immerse the same prototype in water bath, which is maintained at a 37 degrees Celsius, and we got a complete shape recovery within a 500 seconds, and the same we can see in this video. Further, to find out its shape memory behavior, we use a shape recovery ratio as a parameter, and we plotted the graph of shape recovery ratio and temperature at various temperature, and the data confirms as the temperature increases, shape recovery ratio also increases. So further, coming to the in vitro release behavior of paracetamol from the 4D printed construct. So to assess or to prove the ability or effectiveness of the 4D printing technology in drug delivery system, we perform in vitro drug release study in pH 1.2 and using USP2 apparatus at various temperature. So here we took 4 temperatures, that is 32, 37, 40 and 42. 32 is a hypothermia, 37 is a normal body temperature, 40 is a hypothermia and 42 is a hyperpyrexia. So here we can see from figure 13, as the temperature increases, the release rate also increases. That is, at 32 degrees Celsius we got a 50% of PCM release, and that of at 42 degrees Celsius we got 100% drug release, which means that the 4D printing has a ability to monitor or to control the drug release with respect to the body physiological condition. So further, we compare the percent CDR shape recovery ratio and temperature in one graph. So from figure 14 we can clearly say that as the percent CDR is directly proportional to the shape recovery ratio with temperature, as the shape recovery ratio increases, the percent CDR also increases, which proves the effectiveness of the 4D printing technology in controlling the drug release with respect to the body physiological condition. So coming to the mechanism of release kinetics, so we perform different kinetic modeling such as zero order, first order, Rigorci and Corsim RP pass, and we obtain the release kinetic followed first order release kinetic with classical Fickian type of diffusion. So coming to the conclusion, finally considering all the findings, we can conclude that we evaluated the potential use of 4D printing technology in controlling the drug release with respect to the body temperature, and our prototype have an ability to control the drug release with respect to the body physiological condition. And further, the in vitro data shows the monophasic release pattern of paracetamol from the program construct, and further the work describes excellent shape recovery or shape memory behavior of our 4D printed construct. So these are my references. So I would like to acknowledge Science and Engineering Research Board, that is SCRB, Department of Science and Technology, Government of India, for providing necessary funding support. And further, I would like to acknowledge Professor Mohammad Maniruchaman, Pharma E3D Lab, University of Texas at Austin, for providing necessary support throughout the work. Thank you.
Thank you, Purushottam. Over to judges for question and answers.
I'm happy to start.
Purushottam, can you put your video on? Yes.
I'm happy to start. I just want to first comment on the abstract, though. I struggled to find in the abstract when I was reading, you spoke about concentrations of PCL in the abstract. Yes, yeah. I mean, that was before you presented today. And 4D, in your work, 4D printing, just a general understanding of what are the success stories of 4D and the challenges that you would really want to bring to our attention. And then the last question is, you presented that the release was first order release kinetics and classical Fickian diffusion of the PCM. What was the target for your studies?
Sir,
Thank
actually, okay, sir. So for your first question, sir, so we load 500 mg of paracetamol in our gel matrix. And for the second, for your second question, so the success story of 4D printing, sir. Now, in a word, there are 2 or 3 papers who use 4D printing approach for the drug delivery application. Most probably Dr. Lucia Zema ma'am. So she proved the 4D printing application in drug delivery, and she prepared some gastro-retentive drug delivery system and intravesical retentive drug delivery system. And there are other papers such as intrauterine devices, which is work on the 4D printing approach. So during the formulation of 4D printed drug delivery system, so we should know the material. We should first focus on the material property, because the material, if material is not having its own memory, then the 4D printing approach cannot be fabricated or cannot be used. So the first and most important target is shape memory polymer, and the next one is its assessment. That is if you want to prove the 4D printing technology, then you have to prove its shape memory behavior in terms of shape fixity, shape recovery, and all. So the next approach or next main concern during the 4D printing is assessment of its shape memory behavior, sir.
Any more questions?
Yeah, thank you for the presentation. Interesting.
Thank you, sir.
Yeah, I'm just hearing, that was one of my questions. So about what is critical? Is it I would say the starting raw material, or and you mentioned that the properties of your polymer are critical. What about what we call process parameters, the manufacturing parameters? What is critical? Because I'm a bit familiar with 3D printed tablets. 4D is really new to me. So what is really critical, and what should be maybe explored further during your next the next stages of your studies?
Okay, sir. So, sir, during the manufacturing or during the prototyping, the 4D printing or 4D printed dosage form, so the first critical parameter is like, sir, if you say one polymer has a shape memory polymer, then it has some internal points which have ability to change, or which have ability to deform or to reform with respect to the body physiological condition. So the internal net points can be joined with some cross-linking techniques. So we use directly so here some researcher use a photo cross-linking technique for the cross-linking of that internal points, or some researcher use like chemical synthesis. Like during chemical synthesis, they cross-link the other copolymer with like shape memory polymer, which having a shape memory ability, sir. And if you say it is a 4D printing drug delivery system, then it must be integrated with a 3D printing technology. So the synthesized polymer should retain its property after the 3D printing technology also.
Okay, thank you.
Yes, Dr. Sandeep Tipari. You're muted.
Dheeraj, good presentation. Thank you. I just have a question. So 4D printing is nothing but a 3D printed material which is able to change the shape.
Yes.
Response to a stimuli or something, right?
Yes, sir.
So it is mostly driven by the choice of materials then.
Yes, sir. It is mostly driven by the choice of material. If you want to if you want to prototype a pH responsive shape memory polymer, then you can use pH responsive materials. And if it is temperature responsive, then you can use temperature responsive materials.
Okay, so do you see a possibility of 5D and 6D as well then?
Yes, sir. We are working on the 5D printing, sir.
Okay, thank you.
You're welcome, sir.
Very nice presentation once again. I think Dr. Tiwari asked what I thought of asking, so I will continue with the question. But it's a good prospect. The only thing I wanted to know is this particular gel, are you targeting it for topical or oral?
Sir, it is for oral. Sir, it is for oral drug delivery systems.
Oral.
Yes, sir.
So the compatibility of this polymer is being tested. Just a curious question more than.
Yes, sir. Actually, in lots of literature, we found the compatibility of like biocompatibility of polymer. They reported the biocompatibility of polymers, sir. And even the monomers we use for the synthesis of the safe memory polymer, they are all highly biocompatible materials.
So this particular PNIPAM ABP is specific only to temperature. That's the fourth dimension that you have presented.
Yes, sir. It is specifically for temperature response. Yes.
So are there any polymers which are photosensitive or pH dependent? Just to continue on Dr. Tiwari's question.
Yes, sir. There are yes, sir. There are some polymers which is a moisture responsive, sir. Like the well-known polymer moisture responsive is a PVA, sir, polyvinyl alcohol. Even, sir, some acrylic acid containing groups, acrylic acid containing polymers such as methacrylic acid or acrylic acid, they are pH responsive polymers, sir. Even some researcher prepared a composite type of polymer and they combined like ferric chloride or ferrous containing material to give a magnetic to give a magneto-responsive drug delivery system, sir.
And what could have been the impact, just based on your answer, I'm just asking, what could have been the impact if instead of using a 500 milligram dosage paracetamol, you could have used something smaller and made it a smaller dose? Now, what it looked like about a centimeter or so for swallowing, I mean, in the practical view.
Actually, sir, we use a 500 mg of dose because the mostly, sir, in market, we got a paracetamol of 500 mg only. So
you could have chosen a drug which is lesser dose or something. That's my question.
Okay,
loading
sir, actually,
500 milligram is very, I mean, I don't know how it will look like in practical terms.
Yes, sir, we will work on that.
Thank you.
Thank you, sir.
Good work. Keep it up. Thank you.
Thank you, sir.
Judges can note the marks and remarks, and Karun, you can start with the ads. If all judges have finished, we can go to the next presentation. Tarun, can we go to the next presentation?
Sure. Yeah. So the next presentation in series is high permeation vesicle mediated localized delivery of fulvestrant for treating breast cancer. This is presentation by Junia Akhtar from Naipur, Sasnagar, Punjab, India.
Greetings to all. The topic of my presentation is high permeation vesicle mediated localized delivery of fulvestrant for treating breast cancer. The existing marketed formulation of fulvestrant is Faslodex, that is an intramuscular injection. There are certain problems associated with this product. These are gastrointestinal disturbances like nausea, vomiting, hot flashes, and systemic side effects. To overcome these limitations, localized delivery of fulvestrant is a well-approved approach. There are certain barriers in transdermal delivery, like skin structure and its physiological properties, poor physicochemical properties of the drug, and the biocompatibility issues. High permeation vesicles consists of drug-loaded nanovesicle along with synergistic combination of permeation enhancers. These formulations are incorporated into a gel for the ease of administration. The carrier-based rationales are that HPVs are ultra-deformable vesicles, deep penetration potential are attributed to its composition, high molecular weight and solubility issues of the API can be overcome by the use of HPV. Here it is a pictorial representation of the high permeation vesicles, enhanced penetration and permeation through stratum corneum by the alteration of stratum corneum structure. The drug delivery approach based rationales are that the LDD approach has been used, where the localized drug delivery is a way to deliver the drug from a dosage form to a particular site in the biological system where its entire pharmacological effect is desired. A localized drug delivery system can maximize the drug concentration in the breast and minimize the systemic adverse effects, resulting in a potential approach for treating early stage breast cancer. Method for optimization of HPVs. Sodium oleate, transcutol, and propylene glycol were used as permeation enhancers. Their ratios in the final formulation were optimized using optimal response surface design using design expert software. Different independent variables were the concentration of sodium oleate, transcutol, and propylene glycol, whereas response factors or dependent variables were particle size, PDI, and percentage entrapment efficiency. Final optimized formulation consists of 80% of scope and 20% of lipid. Fulvestrant loaded high permeation vesicle fabrication was done by thin layer hydration method. Components of scope, lipid, and drug were dissolved in a mixture of solvents like methanol and chloroform. Thereafter, dried films are prepared in a rotaevaporator at 120 rpm and 40 degrees Celsius for 40 minutes. Then PBS was added in this dried film for hydration and again rotated at 120 rpm for 30 minutes at 52 degrees Celsius. Homogeneous suspension of high permeation vesicles was then sonicated with probe sonicator. The obtained formulation was then tested for size, PDI, and entrapment efficiency upon consideration of percentage entrapment efficiency, percentage of practical drug loading, size, and PDI. From the results shown here, 10% theoretical drug loading was considered as optimized formulation. Method of preparation of HPV loaded gel. Gelling agent Carbopol 934P grade was used based on its good rheological properties and good appearance to load HPV formulation. Gels were formed in 4 concentrations like 0.5, 1, 1.25 and 1.5% weight by volume and analyzed for the rheological behavior of final gel formulation. The procedure of the preparation consists of an accurately weighed amount of carbopol powder was added to the formulation slowly and continuously stirred with an overhead stirrer until the gelling agents completely gets hydrated. After that, NaOH of concentration 10% weight by volume was added to adjust the pH and to get the proper gelling consistency. The results of characterization of HPV loaded gel. From the visual observation, the final gel formulation was found to be clear and translucent with no grittiness. pH of the loaded gel was found to be neutral. The rheological behavior shows that as the shear stress increases, the shear rate increases simultaneously. Thus, it can be concluded that the formulation shows adequate behavior for topical application. The spreadability of gel increases with the increase in the weight applied, which shows that the spreadability of gel can be enhanced by putting force and rubbing onto the screen. From the viscosity graph, it can be seen that with the increase in the shear rate, the viscosity of the formulation is decreased, which shows the shear thinning or pseudoplastic behavior. In vitro release study was performed using the dialysis method. Dialysis bag of molecular weight cut of 12 kilodalton was used. Release media of phosphate buffered saline of pH 7.4 containing 0.5% weight by volume 2 in 80 to maintain the sink conditions was used. The system was shaken at 50 rpm in a water bath shaker that was maintained at 37 degrees Celsius. The drug release pattern of free drug and different formulations were compared in this graph. HPV and liposomal formulation exhibited 81% and 71% drug release till 48 hours. Incorporation of this HPV into a gel matrix further assisted in sustaining the drug release pattern and showed 58% drug release in 48 hours. Drug release from HPV and HPV gel exhibited the highest linearity for the Higuchi model, and N value was found to be 0.39 and 0.33 respectively. That explains the diffusion-based release of the drug. Ex vivo skin permeation study was performed using pig ear skin. Pig ear skin was cut in equal square pieces and used as a membrane in France diffusion cell. The cells were placed in a stirrer with specific RPM and temperature for 48 hours. In the donut chamber, the formulations were applied and aliquots were withdrawn at specific time intervals and were analyzed by HPLC. From the curve of percentage of drug permeation versus time, it was shown that the HPV's formulation of dispersion and gel has permeation of fulvestrant higher than the other formulation. Dermal pharmacokinetic study was also performed, where pig ear skin was removed from the France diffusion cell. They were washed and dried. Tape stripping method was performed to remove the stratum corneum from the skin, and those tape were digested to extract the drug present in the stratum corneum. Further, the skin section were cut into pieces. Those sections were homogenized and sonicated to extract the drug present in the viable layers. Samples were analyzed for the drug content. From the graph here, it can be seen that the percentage of drug distribution in the stratum corneum for HPV gel was considerable, whereas from the percentage drug distribution of HPV gel in transdermal layer was less. From here, it can be said that the drug transmitted to the blood circulation is less, so the adverse effects related to the systemic toxicity can be avoided. Here, HPV showed better permeation through the skin, which proved through the promising result from the ex vivo permeation studies in the previous slide and dermal pharmacokinetic studies here. In this slide, cellular uptake has been shown for different formulations. MCF7 and MDMB231 breast cancer cell lines were used. Here, uptake in MCF7 cell lines has been shown, where coumarin-loaded high permeation vesicles has higher intensity than C6 liposomes and free coumarin. In case of MDMB231 cell lines also, HPVs loaded with coumarin has shown higher intensity than free coumarin and coumarin-loaded liposomes. Cytotoxicity analyses were also performed. Cell cytotoxicity of free drug and drug-loaded formulations were carried out and determined using MT3 assay. From the percentage cell viability versus concentration graph, it can be seen that concentration-dependent reduction in percentage cell viability could be observed. From the IC50 values, it can be shown that fulvestrant-loaded HPVs induced higher extent of cellular death as compared to the free drug and liposomal formulation. From the results of in vivo pharmacokinetic study, it can be shown that the high permeation vesicle treated animals showcased 16-fold increment in AUC and 4-fold increment in half-life values as compared to free drug in gel, indicating the effectiveness of high permeation vesicles in improving the skin permeation. Conclusion. Fulvestrant, a pure estrogen antagonist that has many solubility issues, could be encapsulated in high permeation vesicles made up of a combination of permeation enhancers and phospholipid, giving a nanocarrier size and having good encapsulation efficiency at 10% theoretical drug loading. The release study showed that the HPV gel exhibited sustained release properties. Future prospects of these projects are the high permeation vesicle-based carrier platform can be considered as one of the promising strategies to change the future of transdermal drug delivery, and this could possibly be utilized in the future to deliver other anti-cancer or non-anti-cancer agents. Thank you.
Thank you, Junia. So I could hear the cuckoo sound in the presentation, and that was reminding of a beautiful, nature of Naipur Guwahati. So that was too good. Over to judges for question and answers.
I'm happy to start. Thank you. A very interesting presentation. You touched on many aspects, starting from your introduction till the end. It's appreciated. And I'm just going to zoom straight on one part on the design of your experiment. You went for the D-optimal as an optimization process. You would agree with me that you had a choice of your CCD, your box Benkham, etc. It's two major challenges with the D-optimal. It's sensitive to outliers, and also when you start looking at it, it is also sensitive to misspecifications. What does that mean? It means your initial guesses of the variables that you select when you start, you should be clear about them. Just expand on those two. You had a choice of other experimental designs. You were sticking with the other one, the D-optimal. Let's just expand on that part.
Actually, we have decided fixed the three fixed parameters. So like particle size, PDI, and zeta potential. In those three parameters, we have executed our other things, like here we have taken the components quantity, like phospholipids, other sodium oleate, and transcutals quantity to quantify them about their composition. We have determined the PDI, particle size, and zeta potential. So three variables were there. So that's why we have taken in this way only.
Dr. Sandeep.
So sorry, I was muted. So sorry about that. It's your choice when you go for transdermal. And currently, when you look at fulvestrant, it will be administered IM, maybe once a month, with a huge concentration.
Mm-hmm.
In your plan going forward with the transdermal, what's your thought about the dose when you look at the transdermal as a drug delivery system with its limitations on the concentration? Thanks.
That is the target actually of this project, where we are trying to reduce the concentration of the drug to the blood level, because we tend to apply this formulation on localized tissue. So in that way, the purpose of the formulation is to deliver at first to the cancerous portion, like breast cancer, tumor cells. So after that, there will be chance of the permeation of that drug to the blood vessels. So at first, we want to reach the drug to the target portion, like cancer cells. So in that way, we want to reduce the side effects that may be caused due to the systemic circulation, presence of that drug in the systemic circulation. So in that way, we want to reduce the dose at first. So the effective dose that can reduce the that can affect the reduction of the tumor cells volume. In that way, we can calculate the dose of the formulation. So in that way, whatever the existing dose of the formulation, like IM1, we can reduce that dose also.
Dr. Sandeep Tiwari.
Yeah, thank you, Junia. Good presentation. Really appreciate it. I just have one question. In fact, I have two questions, small questions, and I think this relates a bit to Dr. Kamanga's question also earlier. You have chosen HPV and you have chosen a carrier as gel. Was there any reason you did not consider cream, which might in fact have oils in them and might help? So was there any specific reason you selected only gels and not creams as vehicles? Number one. Number two, you used a rotavapor technique for manufacturing. It's very traditional, commercially not feasible. So did you consider, or are you considering using high pressure homogenization or any other technique which is commercially more viable?
Thank you, sir, for the question. At first, in comparison with the cream, there will be certain disadvantages, like when there will be a oil phase, it will be for long-term use. There may be cracking or phase separation. Already we are using a nanovesicle where there is phospholipid. There is already lipid and aqueous portion. So we are trying to the poorly soluble drug, incorporate this poorly soluble drug fulvestrant into that nanovesicle. After that, if we try to incorporate in cream, then there may be some disadvantages. And here in gel, like there we are using carbopol, and it can be easily formulated, and in case of ease of administration, it will be more easy, because in terms of like I have shown in my data, like viscoelastic property and other spreadability, those things were quite superior than the other things. And about the sorry, sir, what was the next question? I forgot it.
Manufacturing method of rotavapor.
Yes, sir. Still now we have not explored it, but we have in our mind that we will explore in high pressure homogenization also this thing. Because ultimate concern is scale up and marketing of the formulation.
Thank you.
Thank you, sir.
Yeah, thank you, Junia. Just very briefly, my understanding is there is a complete different rank order in vitro and in vivo, because your free drug in gel is showing the fastest release in vitro, while in vivo, although there is no accumulation in the stratum corneum, there is a very low intake. Would you consider that there is absolutely no, this is excluding any possibility for in vitro, in vivo correlation, or do you see a possibility to overcome that?
For free drug, it may show that, but for the for HPV loaded gel formulation, there was a correlation between in vitro and in vivo release. And actually, in vivo is pharmacokinetic one, but ex vivo permission was also quite comparable.
Okay, so you already studied that.
Yes, so for HPV loaded gel formulation, we have compared that.
Okay, thank you.
Thank you. Just a very quick question, Junia. I think in your second slide, I think you showed that this HPVs, when they are transported across the paracellular pathway across the skin, I think you showed that when they get transferred, there is a reformulation of vesicles once it is in the dermis.
Yes.
Why do you think that it happens?
Due to the
Yes, I think
the formation and reformation one through the stratum corneum layer. It
yes.
happens due to the nanovesicle structure, like reformable structure. We have used phospholipid and transcutal and sodium olet because of the components and its reformable structure. It can pass through the transcellular pathway in between the cells and reform inside the stratum corneum.
Thank you.
Thank you. Good work, Julia, and good presentation also.
Thank
Just
you,
to
sir.
continue on Dr. Tiwari's question, you will use temperature, two temperatures while doing the rotor operation. And then you will continue to do that. Just to educate myself more than anything else, this particular formulation, even the marketed one, has to be kept at 2 to 8 degrees. And you can't keep the formulation outside for more than 1 hour, from what I understand. So how is this possible when you are doing it at a high temperature? So that's the relationship. What I mean, that question is related to what Dr. Tiwari is also asking. Why can't you use more impactful preparation?
Yes, here we have decided the temperature of the process depending on phase transition of the lipid and aqueous phase. So we have also considered the degradation of the fulvestrant also. But as far as we have studied, there is no degradation for fulvestrant.
Have you checked at that stage? Have you checked if fulvestrant was intact and it was not degraded? Because of
Yes, after during quantification, we have checked the entrapment efficiency. So from there, we have found the drugs, we have quantified the drug in the formulation. So from there, we can say that it is present.
This is also pH dependence ability for this particular molecule. And officially you can keep it only for 1 hour before injection outside. And it has to be kept at 2 to 8 degrees. So I was just thinking, what is the stability studies on this more than thank you. I mean, if you performed it fine, but I just wanted to get some feedback from you. Good work. Keep it up.
Thank you, sir.
Thank you, Julia.
Thank you so much, ma'am.
So I think judges can take a few minutes for evaluation and remarks.
The judges have finished with the evaluation. We can go on to the next.
Yeah, so here let's move to the next presentation. We are moving from DRPI India to DRPI US. And this is the presentation coming from Angela Wren from the University of Texas, Austin, USA. The title of her research is A Mechanistic Understanding of Drug Release Mechanism from Long-Acting Ethylene Vinyl Acetate or EVA implants.
A mechanistic understanding of drug release mechanisms from long-acting ethylene vinyl acetate implants. Ethylene vinyl acetate-based implants are designed to release drug at a controlled rate for up to 5 years. Long-acting implants offer many advantages over immediate release dosage forms. Compared to oral administration, implants are able to maintain drug levels within the therapeutic window with less frequent dosing. Ethylene vinyl acetate, or EVA, is a semicrystalline copolymer of ethylene and vinyl acetate. Ethylene is highly crystalline, whereas vinyl acetate is fully amorphous. The vinyl acetate content dictates material properties such as crystallinity, melting point, drug and polymer solubility, as well as diffusivity. EVA is ideal for implant manufacturing due to its low glass transition and low melting temperatures and high biocompatibility. Dosage forms can be rationally designed based on fundamental understanding of drug and polymer transport properties. The objectives of this study are to manufacture EVA-based etonogestrel implants, to correlate release mechanisms with measured transport properties, to investigate the impact of storage time on drug release from the implant, and to correlate physicochemical changes that occur during and after manufacture to release mechanisms. The implants used in the study consisted of a 70 micrometer thick EVA-15 skin and an EVA-28 core consisting of 30% etonogestrel. The drug is both dissolved and dispersed in the core polymer, with a majority being dispersed as crystalline solids and a small portion being dissolved in the EVA-28. EVA-15 has lower vinyl acetate content than EVA-28, which results in lower drug diffusivity and solubility in the polymer and higher polymer crystallinity and melting point. The EVA-15 skin serves as a rate controlling layer that covers the implant length, but not the implant ends. The implant manufacturing process consists of 2 coaxial hot melt extruders, which process the core and skin materials separately. The 2 melts are combined and shaped into a coaxial cylinder shape using the coaxial die, and then the melt is cooled down in a temperature-controlled water bath. Initially, the melt has a wider diameter due to die swell when exiting the die, and then is drawn down to the target diameter using a belt puller, along with a laser gauge, which continuously measures the rod diameter. Processing parameters as well as screw design control the amount of drug dissolved, which can fundamentally impact implant properties. And this is something we're currently investigating, the relationship between extrusion processing parameters and implant release, as well as other critical quality attributes. The cooling and drawing down process can impact the EVA crystalline structure, which will also affect release. During extrusion, a portion of drug dissolves in melted EVA-28. The dispersed and dissolved drug is mixed with EVA-28 by the twin screws. Screw profiles that input greater mechanical energy generate more local heat, which will increase the amount of drug solubilized in the polymer. As the melt is cooled down, the drug becomes supersaturated in EVA-28. EVA polymer will recrystallize rapidly with cooling due to its semicrystalline nature. The drawing down process can change EVA crystalline morphology as well as implant mechanical properties. During storage after extrusion, the drug supersaturated in the core will partition into and supersaturate the skin layer. With prolonged storage time, the drug dissolved in the core will recrystallize to a certain extent, and skin supersaturation and core supersaturation will reduce. Release testing was conducted using an incubator shaker at 37 degrees Celsius. And this is the release media we used in both the implant release experiments as well as diffusion cell experiments that we did to measure the drug and polymer transport properties. We used tween 80 in this case as simply a wetting agent, so the concentration was below critical micelle concentration. We conducted full media replacement at each time point in order to maintain sink conditions and also to prevent microbial growth. Visual characterization of the implants right after extrusion reveals dispersion of crystalline drug in the EVA28 implant core. And this core is surrounded by a thin EVA15 skin layer, which does not contain any drug immediately after extrusion. In this picture, you see birefringence in the skin as well, but this is solely due to the semicrystalline nature of the polymer. Immediately after extrusion, there's no drug whatsoever in the skin. During storage, the supersaturated drug in the implant core will diffuse into the implant skin. During the burst release in the initial portion of the release profile, half of the drug that is loaded in the skin will release, and then the remaining portion of burst comes from the fact that the drug in the core is supersaturated and will gradually decrease to equilibrium solubility, which will also be reflected in the skin. In this study, we stored implants at ambient conditions after extrusion to see what the impact would be on initial burst release. We found that after storing the implants for 6 months, the initial burst release reduced by about 50%. Prolonged storage time promotes drug recrystallization in the implant core, which will cause that initial reduction in burst. Burst release follows first order kinetics. This is because the release rate is proportional to the amount of drug solubilized in the core, which is decreasing with time because it is supersaturated. The initial burst can be controlled by specific mechanical energy input during extrusion, and this can be varied by changing your feed rate and your screw speed. And we can also control the amount released during initial burst by optimizing the storage conditions after extrusion. During release, a solid drug depletion zone forms in the implant core, and it forms by moving inward as drug is released. And this will increase the diffusion path length and decrease the driving force for release because the concentration gradient is decreasing. Release rate will decrease with time, but the release profiles in skin and ends will appear different due to the fact that the release through skin the drug has to diffuse through the EVA15 skin layer, which covers the implant length, but not the implant ends. Despite making up only 2.5% of the total implant surface area, the ends do contribute about 18 to 20% to total release. And this is due to the fact that the drug has higher permeability in EVA28 than it does in EVA15, and the ends release solely depends on permeability in EVA28. Release through the skin consists of 3 phases. Phase 1 is that initial burst. Phase 2 is a short-lived steady state phase governed by the concentration gradient across the EVA15 skin. And phase 3 is a gradually decreasing release rate phase, which is due to that solid drug depletion zone forming in the core. We're able to compare our actual release to the predicted steady state release based on the measured transport properties that we determined from the side-by-side diffusion cells, which are diffusivity and solubility. For ends release, we did see 2 key deviations between our actual release profile and the predicted based on the measured transport properties. Number 1 is that the initial release is linear with time rather than linear with square root of time. And this indicates slow drug dissolution relative to drug diffusion in that initial portion, where the diffusion path length is so short that the rate of solid drug dissolving into the implant core is impacting the diffusion rate. Second, we see that clearly the actual release is faster than the predicted. To understand the deviation in ENS release, we conducted microcomputed tomography analysis of a fully depleted implant core. The sample contains an EVA28 polymer matrix with air-filled pores which form due to drug release. In this 3D reconstruction on the left, the semi-translucent gray color represents the EVA28 polymer, and the colored regions represent the air-filled pores, which are colored by volume. The histogram plot on the right shows the volume-based distribution of these air-filled pores, and the histogram plot shows presence of a few very large volume pores and presence of many very small volume pores. The large volume pores are likely due to extensive connectivity of these small volume pores, and this indicates that these pores are non-uniform and much larger than we expected. The air-filled pores being connected represents the solid drug dispersion, and it indicates that the solid drug is extensively connected as well in the implants that are not depleted. And this indicates that our manufacturing process needs to be optimized in order to improve dispersion. So we are currently planning a second implant manufacturing run where we do double extrusion in order to reduce the drug connectivity and improve the dispersion uniformity. This highlights that the optimizing the manufacturing process is critical, and this emphasizes the direct dependence of the release mechanisms on the manufacturing process. To summarize, the implant skin release contains 3 phases. Phase 1 is an initial burst, phase 2 is a short-lived steady state release phase, and phase 3 is a decreasing release rate phase due to formation of a depletion zone in the core. The initial burst is due to half of the drug dissolved in the skin releasing within a few days, and also due to supersaturation in the core, which gradually approaches equilibrium solubility. The ENS release is initially limited by slow dissolution of the drug in the core polymer relative to diffusion, and then increases rapidly compared to the predicted values due to drug diffusion in those connected channels. Our findings highlight that implant release mechanisms are directly tied to the physicochemical changes that occur during manufacturing as well as after manufacturing. So this is my funding and acknowledgement statement. This work was supported by the FDA Office of Generic Drugs. And that concludes my presentation, and I would like to take any questions now.
Thank you, Angela, for that nice presentation. Over to judges for question and answer. Here, Dr. Sandeep, I think you can start.
You're muted.
Yeah, thank you. Thank you, Angela. Very good work. Very nice presentation. Thank you. I just have one, I in fact have 2 very basic and very fundamental questions. Because I look at the TG of your TG of this polymer, I think EVA, I think the TG is pretty low. So given that the TG is very low, we would expect issues on stability over a period of time. Number 1, and number 2, you also mentioned that these polymeric implants are typically implanted for the period of 5 years. So in that case, how do you judge or evaluate in vivo stability in terms of polymorphic transitions of a drug and or polymer?
Okay, thank you for your question. So the first question, the TG is very low. EVA, different grades usually are about -30. And depending on the type of implant you have, there are risks of drug stability, as in the drug may diffuse onto the surface because the polymer is mobile at room temperature. And in our case, because we have a majority of the drug dispersed as solid crystals in the core, the driving force for the drug to diffuse out to the surface is very low because there are many seeds for nucleation in the core. So for the second question, sorry, could you repeat it?
My second question is that, you mentioned that these implants are typically implanted for the period of 5 years. Mm-hmm. In that case, how do you evaluate in vivo stability, right? Or mimic that in vitro in terms of stability?
That's a good question. We haven't actually investigated that for our implant, but there are several
there is a commercially available implant, Nexplanon, which is a very similar system to ours, which contains etonogestrel dispersed and a small amount dissolved. And they are able to deliver drug. Currently, the commercial product delivers drug for 3 years, but they've done additional studies showing that it can deliver drug for 5 years. I actually don't know details about the drug stability, but I'm assuming that if they are trying to get approval to extend the release period for 5 years, that they have shown that the drug is stable in the implant for 5 years.
Thank you, Anjana.
Thank you.
Are there any more questions?
So first, just a comment. I confirm that there are data showing that the drug is stable up to 5 years for the marketed product. Thank you, Angela, for the presentation. Quick question about your in vitro release testing. You are using a small amount of surfactant in your buffer. I would like just to have some explanations from your side about how did you select that composition. And the second point is you showed profiles over 10 days with a fixed volume of medium of buffer. Are you refreshing that buffer, or if not, is there any risk of saturation?
Yes, so the first question, we selected tween 80 as our surfactant. We included this because we wanted to match the release media conditions we used in the side-by-side diffusion cells. And for that case, we chose to add tween 80 as a wetting agent because in the diffusion cells, when we prepare the drug suspension in the donor side, it was very difficult to wet due to its very low water solubility. And so we added just enough surfactant, still within below critical micelle concentration, so that it would help the drug wet but not increase solubility. And we also did some testing to confirm that the presence of tween 80 was not changing the permeability significantly. And then the second question, we do full media replacement for the implant testing. And so at each time point, we'll switch out the entire media so that we maintain sink conditions because the solubility is very low. We want to make sure that we're not reaching saturation.
Okay, thank you.
Thank you.
And good presentation and excellent work. Very impressive. The only thing I wanted to know, already the questions were asked by the previous judges. So the part what I thought I could ask now is, what is the testing methodology used to estimate the drug content in the release?
I had trouble hearing you. Can you repeat that?
How did you estimate the drug concentration in the release? What was the methodology?
So we sample and then we assay using HPLC.
What kind of detection method you probably?
We use a PDA detector.
What was the concentration? What was the LOD of the method, limit of detection?
A limit of detection was, I believe, 0.05 microgram per mil.
Well, what is the total volume, the total concentration, total drug load? Because the marketed product is about 68 milligrams, right? So
Yes, in our market is 68. In our implants, we use 30% drug load, and that's due to some manufacturing issues. So our implants are not exactly the same as the commercial, but we still have a majority dispersed as solids with a small amount solubilized in the polymer. So we have 30% drug load.
So will there be a chance to continue on Dr. Tiwari's question, because I wanted to ask the same, but in any case, is there a stability indicating methodology? Because you might actually check the concentration of the drug itself, but there should be a stability indicating analytical method, which is critical in this particular formulation.
You're saying is there a stability indicating, there should be a stability indicating method formulation?
In addition to estimation of the drug itself.
Yes. So I think that's a very good point because obviously the time scales for this product are very long. It is important to test whether the drug is stable inside of the implant, not just in release. Since we're manufacturing a second batch of implants, the goal for the second run is to make a perfect batch of implants, which the dispersion not only is improved, but we can conduct some additional testing that we haven't done so far. And so stability of the drug would definitely be included in the testing that we're planning on doing for this new batch.
Using a PDA, it is much less sensitive than the fixed wavelength detector. And
Yes.
I'm not well versed with your study. But what I look at is what is the possibility of using the LCMS method so that it will be more accurate and specific to detect all the degraded products. So, I'm just trying to understand.
Well, I think for degradants, we would use LCMS because it's more sensitive. For release testing, HPLC serves a purpose, but I think for assaying degradation, we would definitely have to look at LCMS.
Thank you. Good work. Keep it up.
We are done with questions, then we can proceed to the ads and the judges can note.
I think we can proceed. Thank you, Junia. Thanks for that.
Thank you, Angela.
Thank you.
If all judges are done with the evaluation. Tarun, we can go to the next presentation.
Okay, so the next presentation is titled Comparative Evaluation of Dissolution Performance in USP2 Setup and Alternative Stirrers and Vessel Designs, a Systematic Computational Investigation. Presented by Nilofer Salehi. She is from Eli Lilly and Company, Indianapolis, Indiana, USA.
Hello everyone, this is Nilufar Salehi, and today I'm happy to share our research titled Comparative Evaluation of Dissolution Performance in USB 2 Setup and Alternative Stirrer and Vessel Design, a Systematic Computational Investigation. To start with, I want to give you an overview about in vivo hydrodynamics versus in vitro hydrodynamics. As you know, under in vivo hydrodynamics, in a stomach and a small intestine, the segmentation, contractions, and peristaltic movements are generating hydrodynamic conditions. However, under in vitro system, for example, in this case, USB2, a stirrer, in this case, paddle stirrer, is generating the hydrodynamic conditions. The computational fluid dynamic stimulation for a small intestine fluid pocket shows that the shear rate at its maximum reaches 5 reciprocal seconds. However, for USB2 apparatus operating under 50 RPM, the maximum shear rate can reach 100 reciprocal seconds. Therefore, there are inconsistencies between the in vivo and in vitro hydrodynamic condition, and there should be an effort to make them more comparable. But why hydrodynamic parameters are important for drug dissolution? If we focus on a well-mixed region of the fluid, particles are suspended in the fluid, and each particle is surrounded by an unstirred layer, which is called the boundary layer. Boundary layer differentiates between the particle surface and fluid bulk. The particle radius shrinkage rate or dissolution rate depends upon the thickness of this layer. The diffusion layer thickness depends upon the particle radius or particle size and Sherwood number. Sherwood number has different components of diffusion, confinement, shear component, which is as a function of shear Reynolds number and shear Peclet number, and both of them depend upon the shear rate. Also, the convective component, which is as a function of Reynolds slip number and Peclet slip number. Both of them depend upon delta U, which is the relative fluid velocity with respect to the particle velocity. Therefore, it is very important to understand the shear rate and fluid velocities under in vitro and in vivo system in order to understand the dissolution better. So the present challenges with the in vitro dissolution setups, one of them is coning. Coning means the accumulation of solid dosage form in the dead zone area of the USB2. Also, there is lack of homogeneous mixing and insufficient understanding of the shear rate and fluid velocities. In this work, we address the following. First of all, we introduce the alternative for vessel and stirrer design to resolve the coning issue, and also we introduce new design that can improve the homogeneity of hydrodynamic condition. And finally, we present a comparative analysis of hydrodynamic parameters between current design and alternative designs. The design parameters that we looked in this study are using different stirrers such as hydrofoil, pitch blade, Rushden, and paddle stirrer. We also looked at different design parameters in a vessel such as the diameter of the tank, diameter of the impeller, the thickness of the impeller, the clearance, which is the distance from the bottom of the tank to the bottom of the stirrer. Also, we looked at different vessels. We compared the dish bottom vessel, which has a hemispherical region like USB2 vessel, with a flat bottom vessel. For computational fluid dynamic simulations, we use COMSOL multi-physics software. We solve for the Reynolds average Navier-Stokes equation in rotated frame with addition of Coriolis and centrifugal force. We solve for continuity equation and also the turbulent kinetic energy and dissipation rate of turbulent energy. In another word, we use K-epsilon turbulent model. Here we show the result. We computed the radial velocity in USB2 apparatus in a distance 0.5 centimeter distance from the bottom of the tank, which is representative of the coning area. Here you see the velocity as a function of distance from the center from this center point at different design that we have studied in this work. So first of all, the H4 design, which was a hydrofoil in a flat bottom vessel with diameter of 70 millimeter and the blade attachment angle to the impeller hub equal to 60 degrees, showed the better fluid velocities compared to USB2 and the system that had a similar volume compared to the USB2, but they used a flat bottom vessel. The worst system in terms of generating fluid velocity in the coning area were using hydrofoil or pitch blade when we had the attachment angle to the hub, to the impeller hub equal to 45 degrees. Also, comparing a hydrofoil setup with a 60 degrees attachment angle to the hub showed an improved performance compared to the similar setup with 45 degree the blade attachment angle to the impeller hub. Also, the USB2 apparatus compared to a Russian apparatus had similar performance. Comparing a hydrofoil with 4-blade, comparing a hydrofoil with the same design parameters but having 4-blade as opposed to the one that has 3-blade, the system that had 4-blade showed improved fluid velocities in the coning area. Also, we compared the USB2 with a flat bottom vessel, which had the same fluid volume, the same steerer type, the same diameter for the steerer, and the same clearance, distance, and rotational speed. We computed the fluid velocity and shear rate distribution. And as you see for the flat bottom system, which is P3 system, there is a more skewed function as opposed to USB2, because in a flat bottom vessel, you don't have this hemispherical region. You can generate more homogeneous mixing. Also, comparing a USB2 apparatus, with another design system which has hydrofoil as a steerer, but the same vessel as USB2, we computed the streamline function for this system. And as you see, hydrofoil can facilitate the upward fluid movements better than USB2. Also, that is true when you use the hydrofoil in a flat bottom vessel as opposed to using paddle steerer in a flat bottom vessel. We also computed the volume average shear rate and volume average fluid velocity for all the systems that we have studied in this work. As you see, USB2 apparatus is or design shows the highest volume average shear rate and volume average fluid velocities. Coming back to the point that I made in the first slide, we know that there are inconsistencies between in vivo and in vitro hydrodynamics. The studies such as using computational fluid dynamic simulations and using systematic design, changing the design parameters systematically can help us to find the optimal design. And applying that optimal design condition may help us to improve the IVIVC. So as a conclusion, hydrofoil steerer minimizes the coning and hydrofoil enhances the fluid upward movement. Also, the flat bottom vessel provides more homogeneous mixing compared to the round bottom vessel. And finally, CFD analysis facilitates finding the optimal design. At the end, I want to thank everyone who contributed into this research and our funding agencies. Thank you, and I would be happy to take any questions.
Thank you, Nilofa. Over to judges for question and answers.
Dr. Sandeep.
Yeah, thank you, Nilofa. Good presentation. Really appreciate it. I just have one basic and fundamental question. You mentioned about the curved vessel and the flat bottom vessel. I have two questions actually. Did you look at peak vessel as well? Just because it offers a different geometry, number one. Number two, with regards to correlation of in vivo hydrodynamics to the simulation model, I think there is just a question, how can you correlate it? Because I did see your last slide, which was very good actually. It nicely showed like there is a different hydrodynamics potentially in different parts, and then potentially it is very difficult to simulate. But hydrodynamics is only the one part. There are several other factors that also contribute to, I would say, equivalent or in vivo equivalent conditions. So, what would be your comment there? Just in context.
Thank you for your question. That's a great question. So the first question, we didn't look at the peak vessels because the aim of this, I know that a lot of like peak vessel have been used in order to minimize coning, and specifically it matters for drugs in BCS class 2 because they have like low solubility. In this case, it depends on what questions you are going to answer. If you are going to minimize the fluid shear rate or fluid velocities, we have to move from the current design. And the peak vessel helps with coning, but still we are using a paddle steerer, and that generates a huge shear rate and fluid velocity. About the next question, yes, there are other parameters such as like buffer capacities, there are other like secretion rate. So actually this work started to design the steerer and vessels for our gastrointestinal simulator, which is a setup that we have different compartments and we have secretion of the fluids. So this was only aimed to use for optimization of the hydrodynamic condition. Definitely for non-ionizable drug, this is the most important parameters, but for ionizable drugs, we have to also look at other factors such as buffer capacity, buffer concentrations, and the relevancy of those parameters with respect to the in vivo conditions. Did that answer your question? Mm-hmm. Thank you.
So, thank you. Very good.
Yes.
Yes, may I come in as well? I think I just want to appreciate, I spent some time reading the title of your abstract, and you presented it well to say it's a systematic computational investigation. And that actually helps us in understanding your intentions. My colleague has already presented on this part that there are so many factors that one would actually look at. Just isolating them on one or two variables, it becomes a huge challenge, especially with boundary condition, which gives you a set of constraints. I did quite a lot of work in mathematics when it comes to mixing, especially in tanks, etc. When you look at turbulence, now looking at the GIT, one would argue that the round bottom flasks, they actually give a better representation than a flat-faced one. When you start looking, therefore, of our internal systems. But obviously, one would understand that you want to be systematic, as you have said in your title there. Angle, the height, radial velocity, impeller speed, RPMs, geometry, and all of them. It would have been an added layer as well to mathematically present each variable with its significant value of geometry does this. The fluid velocity, the fluid viscosity as well, which constantly changes, etc. So that's just my comment. It's not necessarily a question to respond.
That's true. That's true. That's a great comment, actually. Viscosity effect, especially for studying the fed condition, is very important. Here, we only looked at the faceted state. Also, the dosage form properties, such as the density of the particles and solubility, can impact the importance of hydrodynamic parameters in this case, because for more dense particles or larger particles, you have these settling problems more, and basically you have a non-homogeneous condition. Thank you for the comment.
Yeah. Thank you, Nilufer. And just a quick follow-up on this. Indeed, dissolution testing is a very regarded test all over the world, especially within SPDS, DRPI, but all over the world. And because of that, we need a very high standardized conditions to compare products. And this is pushing the suppliers to improve the quality of their instruments, but it's also pushing the scientists to pay attention to the testing conditions, and improving hydrodynamics can go towards that better standardization. I just want to use a bad word. It's called discrimination. And the overall objective of dissolution testing is to not to have always a very high hydrodynamic and agitation, etc. But the goal of dissolution testing is to discriminate between good or between different formulations, good and bad, but also different formulations. And the risk of improving the hydrodynamics and agitation, indeed, it's then you have a better agitation. But you pointed out that during the previous answers that you bring to the other judges, the goal is also to be able to see differences in the settling of particles, in the density of the particles, etc. And therefore, if we get better hydrodynamics, are we not losing on the discrimination capability of the dissolution test?
Yeah, that's a great question. Actually, it depends on what is the purpose of using the dissolution test. We can use the dissolution test for QC purposes and distinguishing between the formulations, or we can use it to just justify the in vivo risk, or evaluate how much of in vivo risk we have. So mostly this research was focused on evaluating the in vivo risk of the drugs rather than the QC, because we already have a USP2 as a QC method. Sometimes we have some problems even with evaluation of the formulation in terms of QC with the USP2. This method can help, but in general, this work was more to evaluate the in vivo risk, using the solution to evaluate in vivo risk.
And here I'm just reminding always all the people that I'm meeting that we have to remain very humble, because we have, and I'm super happy to see so many young scientists doing a wonderful job. But we all have to remain very humble, because even though we have very sophisticated machines, these are still very simple models compared to the human body, because so far I've never seen a patient with a paddle in the stomach. But we have to continue working on that. And that's also the limits of what we are doing, just trying to find models to predict what could happen. Okay, but very good job. Yeah. Thank you.
Thank you.
I'm sorry, I can't ask that question. There's a procession going outside my window and it's noisy.
Oh, thank
you. Okay. So, judges, then you can put your, do your evaluation and write your remarks. And thank you, Nilofer. Good
Thank
presentation.
you very much. Thanks for organizing DRPI.
I'm sorry, I can't ask you a question because there's a procession going on the road next to my window, and it's very noisy. I think Ganesh Visarjan is going on. So unfortunately, I don't want to disturb you. But just as a curious question, not as asking you a question, what would be the condition if there is a testing of enteric coated formulation in this condition? What you have mentioned is what I wanted to know. If there is an enteric coated where you have to change phases of two dissolution systems.
Yeah, that's a great question. For this model, the whole scenario was we have like the granules or particles. For enteric-coated, definitely until we reach that particulate state, it takes some time. So probably the hydrodynamic conditions helps to just like increase or decrease the lag for granulation or like disintegration to granules. But in general, like if you go to lower shear rates, definitely that delay would increase, and that might be the in vivo representation of that. But overall, for control release or control release formulation, we have a good IVIVC. This particular research may help more immediate release and where you have the immediate disintegration to the particulates.
Then the question comes is if you use any extended release or a modified release, what is the percentage of polymer that can actually affect the hydrodynamics of that dissolution system? At what level or what percentage? It's something
That's
that
a great.
it's more as a discussion rather than a question. Sorry.
So your question was what would be the percent of polymer?
In case there is a situation where the higher percentage of polymer, at what level you think it will start affecting the hydrodynamics of the dissolution media or the system?
That's a great question. So a lot of dissolution models have looked at this dissolution from the polymer surfaces. So I don't have an example right now, or we didn't look at any control release formulation. We were mostly focused on immediate release formulation for this part. But that's a great question, and I think there should be more work in that area.
Thank you. Keep working on it. This is the pure research that I'm very happy.
Thank you.
Thank you very much. Good luck.
Thanks.
Thank you, Nilofer.
Thank you.
Tarun, can we have the ad?
Yeah, sure.
If all the judges have finished with the evaluation, we can go to the final presentation. Tarun, can we go to the final presentation?
Sure, ma'am. So here we are with the final presentation for this category. The title is Development and Validation of Microdialysis-Based Discriminatory and Biorelevant In Vitro Release Testing Instrument for Complex Ophthalmic Products. This is presented by Sushesh Srivastav, Palakurthi, Texas A&M University, Kingsville, Texas, USA.
Hello everyone, my name is Susesh and the title of my talk for today is Development and Validation of Microdialysis-Based Discriminatory and Biorelevant In Vitro Release Testing Instrument for Complex Ophthalmic Products. Now let's take a look at the challenges and the complexities along with the scope of research that ophthalmic drug delivery provides. So as we all know, eye is a complex organ. The anatomy of the eye is complex. It provides a very limited residence time for any formulation that we put in there. It has a bunch of ophthalmic barriers, and also the tear film dynamics in the eye are very variable. So coming to the formulation challenges, the sterility, stability is a challenge, dosage accuracy, container closure system, manufacturing processes, and these are a bunch of challenges that ophthalmic formulations have. So now, demonstrating bioequivalence for any ophthalmic product it's actually very difficult and pretty invasive to perform a PK endpoint study. So here comes the scope of our research is to develop and validate an in vitro release testing instrument and a method which is robust enough and sensitive enough to not only prove the sameness but also catch hold of the pitfalls of any differences in the formulations. Of course, this comes along with a bunch of advantages, which is cost cutting, reduce the economic burden on the healthcare system, which would also accelerate the generic product approval. For a generic product development, especially for that of ophthalmic products, besides the IVRT technique, there are a bunch of other critical quality attributes, which when measured in an in vitro setting, if they are same for that of the generic product, it is expected that both the generic product would actually perform same or similarly in an in vivo setting and also in a clinical setting. So there is actually this is in par with the guidance that is given by the US FDA, which talks about the in vitro option for generic product development of an ophthalmic drug product. Now actually how we approach the problem to develop and validate our method is by formulating a bunch of different formulations. As you can see here, RLD is a 0.05% strength difluprednate emulsion product. The F1 formulation, it's a Q2 equivalent formulation to that of the RLD, which means it's both qualitatively and quantitatively equal to that of the RLD. F2 is a half strength product. F3 is a double strength product. F4 is also a Q2 equivalent formulation, but there is a formulation technique variable there. And F5, it's actually not an emulsion, but it's a micellar product. You will actually understand why we chose to formulate all these different types of formulations in the upcoming slides. So here are some of the critical quality attributes that we try to measure, such as particle size, PDI, viscosity, and pH. If you can see here, they look pretty much similar except for that of the micellar formulations, which is pretty obvious because it's not an emulsion, it's a micellar formulation. And also there is a significant difference in the particle size for that of the F4, which is actually a heterogeneous Q2 equivalent formulation from that of the F1. Particle size distribution of the emulsion globules is actually a very important critical quality attribute. So it is actually determined by calculating the span values. If the globule size distribution of the emulsion product is unimodal, then span value calculation will do. If it's a bimodal distribution, then we need to perform a population bioequivalence study. So if we can see here, the F4Q2 equivalent formulation has a significant difference in globule size when compared to that of the F1 or the RLD. This is because the F4, the heterogeneous formulation that we formulated, is not subjected to microfluidization once it's formulated. So that's actually attributed to the significant difference in the particle size here. Before getting into the details of the IVRT technique, let's try to understand the basic differences between a quality control dissolution and a biorelevant dissolution method. So here I would like to compare our method to that of USP4. Of course, every method has its own pros and cons. USP4, the method parameters can be optimized easily. T10, T50 and T80 can be determined. On the other side, because of longer sampling time point, stability issues may arise and it is very minimally biorelevant. Whereas our method, the method parameters can be optimized easily. The sampling time is as early as 1 to 2 minutes. It is very biorelevant in terms of flow rate, volume of the sample that we collect, perfusion medium, and the sampling time. Of course, T10, T50, T80 determination is very difficult, and we need to have a robust analytical method for doing this. So now, being said this, what we believe is a combination of a quality control dissolution and a biorelevant dissolution would actually accelerate and also improve the confidence in the generic product that is being approved. This is a cartoon that shows the working of our instrument. As you can see here, here is a syringe pump with a syringe fixed to it. The vial here has the emulsion in it, which is stirred and maintained at a given temperature, and there is an autosampler here. So the syringe is filled with the perfusion fluid or the release medium, which actually flows through these tubings, and it reaches the probe area where the actual diffusion occurs. And at a given time point, the samples are collected with the help of the autosampler here. So this is the depiction of a typical microdialysis instrumental setup that we have in our lab. Now, these are a bunch of factors that we actually consider to optimize, which are pH, membrane type, dilution ratio, membrane cutoff, flow rate, and perfusion fluid. So we actually ran the experiments in triplicates, and when we finally optimized the factor, we moved forward for performing the actual experiment. Now, if we take a look at the release profiles here, actually to simulate the differences in the manufacturing processes, and also to make sure that the probe or the membrane that we are using in the probe is not acting as a barrier for diffusion, we decided to formulate a variety of formulations here. So if we take a look at the release profiles, the RLD and the Q2 equivalent F1 formulation, the release profile is pretty similar. Micellar product and also the F4 Q2 equivalent formulation, which is a heterogeneous formulation, they are significantly different. Of course, the half strength and double strength emulsion formulations are also significantly different from that of the RLD or the F1 formulation. So the point that I want to make here is the approach that we used is not just able to validate the method that we developed, but also the instrument. So it's like we are able to leap 2 hurdles in a single jump. After understanding the release profiles, we conducted a statistical test, which is called the Wilcoxon test. This test is actually recommended by the US FDA to compare the equivalence for topical products. So when we compare the RLD with that of the Q2 equivalent F1 formulation that we developed in our lab, they actually pass the test. But when we compare RLD with that of the other products or the other formulations that we developed in the lab, they tend to fail the test. Moving forward, we actually tried to do an in vitro in vivo extrapolation. So to actually predict the drug absorption from the human cornea, what we tried is we tried to extrapolate the release obtained from the probe surface area to that of the human corneal surface area. So when we plot RLD with the in-house Q2 equivalent test formulation, which is F1, the plots tend to overlap with each other. In conclusion, the microdialysis method was developed and optimized, and the different parameters such as the composition of the dissolution medium, pH, molecular weight cutoff, of the probe, nature of the membrane, dilution ratio, and the flow rate were optimized. The final optimized conditions were using a 10 millimeter length of polyether sulfone membrane probe with a molecular weight cutoff of 35 kilodaltons. The perfusion fluid has 1% albumin with 0.1x PBS at pH 7.4 with a flow rate of 4 microliter per minute and a sampling frequency of 2 minutes were optimized, and the experiment was conducted at 35 degrees centigrade. These conditions were found to be the optimal, and the sameness of the RLD to that of the in-house developed Q2 equivalent test formulations, which is F1, is proven by both statistical test and also the IVIVE experiment that we conducted. Now, an important point that I want to make here is the method that we developed is actually able to prove the sameness of same formulations and is also able to catch hold of pitfalls of the formulations that are different. Moving forward in the future directions, we would like to standardize the microdialysis instrumental setup that we have, and also we would like to develop a semi-automatic or an automatic instrumental setup so that this technique and this instrument can be applied across labs and in the industry. Now I would like to take a moment to acknowledge US FDA for its initial funding, Department of Pharmaceutical Sciences at Texas A&M for their continued support, and DRPI for giving me this wonderful opportunity to present my work. Thank you one and all once again.
Thank you, Susesh, for that nice presentation. Over to judges for questions and answers.
Yes, Kamangasa.
Yes, I'm happy to start. Thanks for the presentation. I listened to your talk and I also went back to the abstract. Just take us through your F1 and F4, which were prepared by changing the process parameters. I just didn't get that part well. Systematically, the logical sequence at which this was done, and you just touched on it here. Thanks.
Sure. So yeah, thanks for the question. So the basic difference between F1 and the F4, which is a heterogeneous formulation, is that after preparing the emulsion, the F4 was not subjected to microfluidization, whereas the F1 was subjected to microfluidization. So that's the major difference between F1 and F4 there.
Just would like to take over. Thank you, Suhesh, for the presentation. Interesting. Can you just, based on the schematic that you presented with the syringe pump, the kind of vessel or recipient, and the fraction collector, you mentioned that there is a microdialysis membrane somewhere. Is
Yes.
it on the way? I mean, from the vessel to the fraction collector, or I mean,
Yes.
I don't know where the drug release is occurring.
Yeah. So if you remember it from the schematic that I presented, the perfusion fluid will flow through the tube, and then it enters the probe area. So in the container or in the vial where we have the emulsion, we have the probe inserted in there. So, and there the actual diffusion occurs, and it's a continuous thing. So as it keeps moving, we collect samples with the help of an auto sampler at a given time point.
Okay, so the drug product, the formulation, is introduced into the tube directly.
No, the formulation is present in the vial that is being stirred and maintained at a given temperature in the vial, and the perfusion fluid is kept passing through it, and the diffusion of the formulation into the release medium occurs, and it gets collected.
Okay. And did you evaluate, because here we have a stirred vessel, your stirred tube, did you evaluate the effect of agitation speed? We had the previous presenter speaking about hydrodynamics.
Yes.
What could be the effect of the dimension of your tube, the agitation speed, etc., on the release rate? Because then I would say the release is mainly driven by what happens into that tube, not really by the dialysis itself.
That's true. So Yeah, that's a good question. So the stirring rate that is maintained in the vial is 150 RPM. So that is to mimic the blinking of the eye, because this is an ophthalmic formulation, right?
Okay.
And as we instill, so one thing that we need to understand here is, after instilling any kind of eye drops, they wash out pretty quickly, right?
Yeah.
So that's the reason why we wanted to understand the release in the first few minutes. So the stirring rate that we maintain is 150 RPM, which we wanted to mimic the blinking of the eye. And it's a continuous flow. And then the sampling time is every 2 minutes. So we keep collecting the samples for every 2 minutes.
Okay. Okay. Thank you. Thank you. Good luck.
Thank you.
Yeah, thank you, Suresh. Good presentation. I just have one question, and I think you probably answered it or addressed it in the presentation earlier. Often, like you cannot use a single method for topical formulations when it comes to bioequivalence, right? Which is challenging, and that's why IVRT techniques are being explored. And I think you also showed a guidance. Is there any update on any products being approved with the use of IVRT in terms of biowaiver?
Yeah, that's actually a very good question. So for the difluprednate ophthalmic emulsion that I just used as the reference product for our study, there are 2 generics of this particular product approved already.
Using IVRT?
I'm not sure whether they were approved absolutely based on in vitro technique or not, but there are generics approved. But the point that we want to make here is, even though there are 2 generics already in the market, the cost of the Durezol or the difluprednate emulsion has not gone down. Or because what we are trying to do here is, this would actually accelerate or give more confidence in the approval of the generics. So there is a draft guidance and there is a presentation by the US FDA where they actually accept the applications based on just in vitro options. Because we can't prove TAT with our particular method, I don't think this is not a standalone method. That's what I wanted to mention even in my presentation.
Okay, thank you. Yeah.
Anybody else?
Yeah, good presentation and nice work, and looks like very innovative in its nature. Just wanted to know, what is the sampling volume for your samples at every 2 minutes? What is the volume that you sample?
Yeah, the sampling volume is like 8 microliters.
So how are you, what is the method of analysis? That 8 microliter, how are you analyzing?
Yeah, our method of analysis was HPLC.
Do you have an injection system where it can take that entire 8 microliter? How much is the injection volume then?
Yeah, that's a good question. So the injection volume is 10 microliters. So the sample that we obtain, we dilute it and then we inject it.
So it's already diluted, because looks like it's a corticosteroid, number one. I don't know if you have what is the detection system? UV? It's a corticosteroid.
Yeah, the detection is UV, and the detection limit that we have with our method is 22 nanogram is the limit of detection. 22 nanogram per mil. Yeah.
At what wavelength are you detecting this 20 nanogram?
If I'm not wrong, I think it's around 280, 284.
I'm a bit not convinced on that. If you have 8 microliter and then you're diluting it to 10 microliter.
No, we don't dilute it. We dilute it to 20 microliters.
You dilute it to 20 microliter and then you inject?
Yeah. So
how much
it's
into
the injection volume is 15 microliters. The minimum that we can inject in our system is 10 microliters, but we inject 15 microliters. So in
what's the configuration of your head? What model is it? Just
the Shimadzu. Yeah. So the strength of the emulsion is 0.05%, and we use 600 microliters of the emulsion, which is roughly around 30 milligrams of the
UPLC. For example, if you use Acuity, You the accuracy of your injection, 8 microliters, you can go directly to 1 or 2 microliters easily, right?
Yes.
Actually, it gives better advantage for you. I thought because if you're diluting it, that means your error is amplified.
Yes.
Every time you dilute something at that kind of volume, your error, even at 90%, it is 10% error is amplified. And your that is why I'm seeing all the error bars are very high as you go in the graph.
Yes. So what we can do is by running multiple replicates of this, for doing the statistical test also, we ran like 6 and 12 replicates. So of course, we might still have the error bars huge because of the low sample volumes, but to improve the confidence on the data or the result that we obtain, doing multiple replicates would help.
But I personally, I would suggest that's the reason I asked Himanshu. Or I mean, I'm not picking up any company here. It's not my, intention. But from what I know, if you have a low injection volume, high accurate system, the injection volume that can be so 8 microliter, you can directly put it in the wire, the insert, manual insert.
Yes.
And from the insert, you can directly inject 1 or 2 microliters or even 5 microliters for that matter. But then you will have only one injection at one sampling point. So you will not have a triplicate or a duplicate.
Yes.
That worries me statistically.
Yeah, we run the experiment in different replicates.
But still, it's a different experiment. It's not at that
That's
time
true.
point.
Yeah. Yes. I agree. Yeah.
I don't know. I'm just discussing with you. It's not like a question, but I just
Yeah.
want to understand.
Yes. Yeah, I totally agree. So yeah, if you look at the comparison of the USP4 and our method that I was talking about, so I was also we are aware that we need a very robust analytical method, but the method and the sensitivity that we have was sufficient enough. So
because the corneal volume itself is 4 microliters.
Yeah.
You understood the corneal volume, and that way it goes through the canal of Schlemm into the nose.
Yes.
And you lose it. So
yes,
that's why I don't know if you want to amplify your sampling volume better.
No, yeah, that's actually a very interesting question. Yeah. So if we amplify the sampling volume, we need to increase the flow rate. So the flow rate that we are having right now is 4 microliters per minute. We optimize that to mimic the in vivo condition, which is the corneal fluid turnover. And we can still increase and get more than 8 microliters, but we would be moving away from biorelevance. That's point one. And the other point that I want.
I'm only looking at how to improve the accuracy of your estimation, so that the concentrations are more accurate. That's all. I'm not actually going to the other part.
Yes. That's I totally agree with that. Thank you so much for the suggestions.
Pleasure. Good luck. Good work. Keep it going.
Thank you.
We'll see you sometime in other fora. Good luck.
So we can now request the judges to note their marks and remarks.
Overall scientific treat today. Overall scientific treat. And a tough competition overall. Real enjoyed. Not like to miss a minute. So that total objective of DRPI is very well achieved today, I will say. Thank you. Thank to judges for really doing the hard work and being present all the time. Please go with your evaluation. Please continue.
Tarun, till the judges note down, can we have the ads?
Dr. Krishnapriya, if you wish to announce tomorrow's brief agenda, you can do so now. What time we start and what time we close.
So for tomorrow, it's again, we meet at 17 hours Indian Standard Time. And the agenda, which is available on the SPDS DRPI website, we have all the different time zones and what are the times for that. And we would want everyone to be present tomorrow so that we can have a look at the masters and PharmD presentations, and followed by the exciting valedictory function and the awards ceremony, where we'll be presenting awards for the late researchers, that is today, candidates, and the early researchers whom we will evaluate tomorrow. And we want everyone to be present throughout so that we will enjoy your participation also in this great event. Now, after the judges have noted down the marks and remarks, we will have the introduction of the judges by Dr. Munira Momin. And with that, after that, we'll have the concluding remarks. And then we will meet tomorrow, same time as you have joined today. Thank you.
Quick question, Krishna Priya. I'm sorry. Do we have all the candidates joining, or because I see that Suhesh is still connected?
See, we will be going after our introductions. We will be going to the breakout room.
Okay.
Okay, so that will be only judges.
Okay,
No
so we have.
We'll go to the breakout room after your introduction to all the participants who are present and the viewers who are present here. Okay, so because we have not introduced you all. So that
we can
honor,
do that. Yeah, we
is
can
going
do
to
that
be done
now.
by Dr. Munira.
Sure.
It's only after everyone, puts a thumbs up that they have finished noting down their marks.
For me, it's okay.
Yes. So Srinivas Padnala sir and Kamanga sir. Okay, Dr. Munira. So Tarun, if we can have the judges' slides. See, I would like to just mention one point, is that incidentally, all the judges, their first names start with S.
S.
Adding to that, Krishnapriya, that is the most best letter in the alphabet dictionary. Yes, denotes success.
And for your information, all the judges of tomorrow are also with us.
Also with us.
So in success, there are many S. Success and sweetness and sugar, all are good for everyone.
Okay. So, Dr. Munira, over to you.
Sure. Yeah, thank you, Dr. Krishna Priya. Yeah.
Allow me just a minute. I want to make an announcement that in webinars, basically, we don't have a separate breakout room. So what we'll do is, after the webinar ends, I'll send a separate meeting link in the WhatsApp group, which is only for the judges. So kindly join through that link. Okay. Yeah, for the finals. And we'll be closing this webinar after this gets over. Introduction. Thank you.
All right. All right. Thank you, everybody. What a brilliant, scintillating session and brilliant questions from all our esteemed judge panel. It was indeed a learning experience. Students, teachers, researchers, everyone has learned something from brilliant presentation from students. We feel so proud to see students doing excellent work, mentored by excellent guides. And today they were judged by brilliant judges, very, very relevant questions. wonderful, insightful questions which have made them think. I think some of them, majority of them, let me put it that way, majority of them have learned something from each one of you, our judge panel. Let me introduce, start with, as we said, there is whoever, like in my panel, whoever is the first, I'm going to start with this. Dr. Sandeep Tiwari, thank you very much for your insightful questions, very, very relevant, industry relevant question. Let me introduce Dr. Sandeep Tiwari formally. So Dr. Sandeep Tiwari has earned his PhD from College of Pharmaceutical Sciences, Manipal, and followed it up with his postdoctoral fellowship from Northeastern University, Boston, Massachusetts. While in India, Sandeep worked for Zydus Cadila in the novel drug delivery system, and it actually reflected in a lot of his presentations, a lot of his questions. Prior to his present position at BASF, Dr. Tiwari was also a fellow manufacturing science and technology at Teva Pharmaceutical, and he has also served at Colorcon as a senior manager, global technology development, and then a technical director. Sandeep has been a prolific publisher and has penned 1 book and 8 book chapters, monographs, and contributed more than 100 research publications and conference presentation in the area of doses from design, new technologies, dissolution science, and excipient. Dr. Sandeep Tiwari, thank you very much. You have indeed made a difference in students' presentation by students' knowledge by posing those questions to them and making them think further more than what the data we're talking. Our second panelist, Dr. Srinivas Patnala. He earned his BPharm degree from Bangalore University and master's from Rajiv Gandhi.
1 minute, Dr. Munira, let the slide change.
Okay, I'm changing my slide. That's why probably.
Yes,
I have my own slides.
Slide has changed.
Okay. Dr. Patnala earned his master's degree from Rajiv Gandhi University of Health Sciences and PhD from Rhodes University, South Africa. His subject of interest are pharmaceutical analysis. And Dr. Srinivas, I must say that each question coming from you were really based on pharm analysis and instrumentation techniques, focusing on, and his area of interest is focusing on analytical method development. He has worked in the pharmaceutical industry in quality control, quality assurance, and related R&D departments. In 2010, he joined KLE University as a professor in pharma analysis before taking over his current responsibility at a Rhodes University. He's engaged with consultancy services for pharmaceutical quality research, design, and training, and appointed as an editorial advisor in Tyler Francis and other famous, known, globally renowned publishing houses. He has published multiple scientific journals, and he's also associated with WHO Geneva as an ad hoc expert for reviewing analytical monographs of international pharmacopoeia and pharmaceutical pre-qualification programs. Dr. Srinivas, you indeed made a difference today, and all these questions, when they were related to the dissolution technology, your questions were directly towards the analytical techniques. Thank you very much for making students understand the importance of analytical techniques. Our third judge panel today is, can we have a next page?
Tarun, can we have the next slide? Mr. Samir Hadochi. Munira, you can
Mr. Samir Hadochi, pleasure to introduce you formally to the group of scientists and professionals who are those who are engaged into dissolution science. Dr. Samir is a chemist, and he began his career in the analytical development of agrochemical compounds at Sandoz Agro at Basel. And during the Novartis merger, he moved to Orléans, France in 1998 to join the analytical group in the technical development department, where he became responsible for dissolution. I have personally heard him at a couple of conferences talking about dissolution. It's indeed pleasure listening to you, Dr. Sameer. And today your questions which you pose to students have made them think that dissolution science is very important science for any product development. Let me further go ahead with Dr. Sameer's introduction. In 2005, he resigned from Novartis to create SPS Pharma Services in Clermont Ferrand, which is the first and the only CRO specialized in dissolution and release testing. And since then, he manages SPS facility and is in charge of project management. In April 2013, SPS Pharma Services moved to new larger facility in Orleans in order to ensure better efficacy. And Sameer's field of interest and expertise is analytical development. I'm going to go here because there are some of the lines I can't read over there. Analytical development, in vitro dissolution, and release testing. Sameer is regularly invited as a speaker in international conferences as well as expert for various organizations. Thank you, Mr. Sameer, for always being there for DRPI and encouraging young scientists.
Pleasure to be here.
The next panelist today is Dr. Sandile Kamanga. Sorry, I'm sorry, Kamanga. Dr. Kamanga is associated with Swaziland Medical and Dental Council, Pharmaceutical Society of South Africa, and American Association of Pharmaceutical Scientists. He has received research development grant for Y-rated researcher at Rhodes University, South Africa. He's a passionate teacher and a researcher. Dr. Sandile, we could see your passion for teaching and your passion towards product development and dissolution while you were posing the question to all the presenters. Let me go ahead with his presentation, with his introduction. He has taught his students pre-formulation studies, solid oral dosage form, targeted and novel drug delivery system, parenteral formulation, and role of physicochemical property of drug on the performance of the formulation. He has undertaken multiple research projects, and his research interests are design of experiment and response service methodology, mathematical and statistical modeling of drug release kinetic, formulation development and process optimization, microencapsulation for beta testing drugs, and solid state characterization of pharmaceutical. He has published his research work in a number of high-repute scientific journals, and he's currently associated with Rhodes University, South Africa, as a dean and head of the Faculty of Pharmacy. Professor Sandile Kamanga, thank you very much for your insightful questions. Over to you, Dr. Krishnapriya.
So, Tarun, can we stop sharing?
Priya, can we
Yes.
give 2 minutes to each judges to express how they feel?
Yes. So
Yes,
can
please.
we
I mean,
sharing?
that would be really great if we
Listen
have
from them.
some comments from all the judges.
How they feel of participating in this, and if there is any suggestion to improve further,
yes,
we can express.
Please.
Yes. We start with Sandeep Tiwari in the same order. Sandeep, are you there?
Yes, yes, I'm there. Sorry. Thank you. Thank you, Dr. Ramaswamy, Dr. Munira Momin, Dr. Krishnapriya, and everybody present here. I would like to start with wishing a happy birthday to Dr. Vinod Shah, who has been guiding us. I think how I feel about participating here, I think I really feel energized. You know, I really feel myself like going into the lab and working and doing some work actually. So it was really very inspiring. I think every student or every researcher here, you know, I think whatever work they presented was really very thorough, very scientific, and I think everybody really made a, I think, you know, a genuine effort to really, you know, I think the name of this particular conference was Early Researchers, PhDs, Postdocs, and Industry, right? I think you could really see that actually. Yeah, you can really lead researchers. You can really see that in each one's presentation. So I think I was really very happy and glad to have been given this opportunity. Thank you. And I think it was really great experience also to hear from other panelists actually.
Thank
So
you.
thank you. Thank you.
Thank you, Dr. Sandeep.
Go to the next second one.
Yeah, good evening to all of you again, and wonderful and good morning to people in the US. Thank you, Dr. Ramswamy, for adding me on this panel, and Dr. Krishnapriya for communicating with me and keeping me informed about something. And rest of the panel members and Dr. Charanjit Singh for his wonderful insight into creating this great association. Frankly speaking, it's been a learning curve more than me asking questions. I'm just asking questions based on what I want to know. So it obviously gives me an idea to see how other groups are functioning, what is happening in the new research. And this being an international, it's really on the mark, and it's really way high above all these conversations that I have been involved with. And this really takes the cake. And to be frank, a wonderful judges panel here, and my esteemed colleague and Dean Faculty of Pharmacy, Professor Chandile Kamanga, is here, and really honored to be on the same side with him. And we have been associated over 20 years, and it's great. And coming back to Dr. Munira's comment that I go into the analytical part of it. One thing I have understood in all the research that I have done over so many years is whether it is industry or academic, is ultimately we calculate everything based on the concentration that we determine. So I am more interested in finding out how accurate is that concentration. That's my interest. And if I know that this methodology, what was used, is validated and it is appropriate for that particular experiment, then I take that particular, entire set of results as it gives me confidence to say that yes, this is a good research. That's the concept in my head, and being analytical, I go into that detail. So accuracy and repeatability, reproducibility are three key components of my research. Thank you very much again for this wonderful opportunity. And I also appreciate all the participants, the best, and keep working hard and do well in all your endeavors, and hope to see you. Our path shall cross. It's a small world.
Thank you, Srinivas. We can listen from Samir now.
Yeah, Mr. Samir, if you can have few words from you.
Yeah, just wanted to first thank all of you. For me, I was already part of this judges faculty in the past, but I always feel very honored to be here and to contribute at my scale to these events. It all started in India. It's getting global now, and it's I don't like the word competition, but the goal is just to have this bringing more motivation to students to just try to be better tomorrow than yesterday, and that will improve the global research for all continents, all countries, all faculties, all colleges, and at the end, mankind will benefit of that research and those progress in medicines. One comment that I made for some of the presentations today, what is really important is to keep in mind that innovation is nice to have very sophisticated products, but innovation can also help just to make drugs more affordable and to facilitate the access to simple tablets. But if you can make that more affordable, more accessible, that's also innovation. It's also progress for all of us. And I'm just impressed by all what our young scientists are doing. Of course, under the leadership of their teachers, professors, because I know, I think 2 weeks ago or 3 weeks ago was the Teacher Day in India. I think it's
5th September.
Yeah, okay. So it's I think it's quite unique because in Europe, I was discussing with some colleagues here, teachers are not enough considered, I think. So it's nice to have a teacher day. And so just very happy to see all those students working hard and to see the outcome of those research. So thank you very much for having me here with you, and looking forward to a nice celebration of all participants, not only the winners.
We should thank Samir to accept in a short notice, and thank you, Samir, for accepting. As like Teachers' Day, I'm thinking of Dissolution Day also from next year. We'll come back to you soon. Global Dissolution Day. It will come.
Over to you, Dr. Kamanga, please.
Yes, Dr. Kamanga.
Thank you so much, and it's hard for me to really find words to thank each and everyone who's here this evening, this morning, this afternoon, depending where you are. It's to me, it culminates to something big and converging to something special. Taking this forward, it could think about a chapter in Africa. And I really thank DRPI for this opportunity. And I've been educated today. The participants, the students, it's really something that I don't take lightly. It is something about what I always impress to my students is the world never sleeps. If it's a morning somewhere, it's an afternoon elsewhere. It's an evening in some parts of the world. So today we've really validated that statement. It's 6:25 in South Africa at the moment, and I'm really excited about this, and also to thank Dr. Patnala. I've known him for 21 years. And incidentally, today, I also want to say happy birthday to Dr. Vinod Shah. He shares the birthday with my son. It's his birthday today. And Dr. Patnala knows my son, and he's a young cricket player. And once again, I just want to say that I will join tomorrow, but I'm not going to be disruptive. I'm just going to be in and out. But once again, thank you so much. I appreciate.
I think,
thank you, Dr.
Kamanga.
Kamanga.
Just take a minute, sorry to interrupt here, because Srinivas, you know, some years back we were thinking of doing Disso Africa in that university. Srinivas knows, and there was a professor who visited DCP.
Yeah.
And, instead of Kamanga, I think someone else was there at that time.
He was the dean at that time, Dr. Santi Daya.
Yes. So I was anyway, very nice that Dr. Kamanga is there. We will definitely take up that, and under his leadership, we will do a Disso South Africa, I mean, as and when possible. So thank you, Dr. Kamanga. You are now part of SPDS family. We'll keep you, and tomorrow Tarun will keep you in the panel, and we will together will listen.
And we wish Dr. Kamanga's son a brilliant year ahead on behalf of DRPI and the entire DISO SPDS.
His son's name is Inkinyate.
So,
it means star.
Oh.
So that's a beautiful name that he has kept for his son. And incidentally, his wife is also an expert chemist. She is a PhD holder in chemistry.
Oh.
The same university. They are a power couple.
Great. Thank you. Dr. Munira, back to you.
So may I say a few words?
Yes, sir. Yes, sir. Concluding remarks by you.
No, not a concluding remark, but it's a big day for us that we have started we had this global final for DRPI, and happens to be the birthday of Dr. Vinod Shah. Why not to celebrate 23rd September as a global dissolution day?
3rd September. 23rd September.
23rd September as a global dissolution day, if everybody in the house agrees, as a tribute to the birthday of Dr. Vinod Shah.
Oh. 23rd September. Done. World over, we'll have dissolution conferences. next year. I don't know how many places Vinod can attend, something personal, something or next.
Well, nowadays we can attend virtually, so I can attend all over the world at the same time.
September.
Dr. Shah, please consent. Please consent.
Yes.
That's all that we require. And your final word.
Well, no, it was a very excellent presentations. I've been listening to all the presentations from the morning until now. And I agree with what even Dr. Munira and the other people have made the comments that all the questions from the judges were very appropriate. Actually, all the presentations were so good that it was very difficult, I'm sure, in the judges' mind to pick up the best number 1, 2, and 3, but we'll find that out tomorrow. With all the bright intellectual capacity of all the judges, we'll know the best results tomorrow. And just incidentally, I think the person we are talking earlier from South Africa, I think was Dr. Walker.
Dr. Rodrigo Walker.
Yes, Dr. Walker, who was there in South Africa at Rhode Island. And also, I think with Dr.
Easy Camphor.
Easy Camphor, who is now in Canada.
Yes.
We are talking with those two people in Rhode Island sometime few years ago.
Yes.
Well, so it was excellent, very well done, and almost in time, most of the cases until the break. Then we got slightly relaxed. But I think it was good still overall compared to the standards that we were having it before. So I'm very, very pleased with the total outcome of DRPI. It's like our dream come true, you know. We wanted I to India and it has happened now. I'm sorry, I India to international, and that has happened today. So that's wonderful.
We will have your valedictory address tomorrow, a long one. So words of wisdom, complete words of wisdom tomorrow. So thank you so much. Kishan, Priya, and Tarun to close the session.
Okay, thank you everyone, especially the judges. We know it was last minute and all of you have agreed to come. And I would just tell all the participants, each one is a winner. And we definitely know that you will do very well in the future. And please take this opportunity of being part as DRPI as just a stepping stone to much more that you are going to achieve in your life. And we thank all the participants who have joined us today in large numbers and all the dignitaries here. Thank you so much. And
Mr. Ma'am, just
yes,
one thing. So we have certificates for judges, and
yes,
I believe Dr. Khamanga, may not
it's
be
not
there
there
tomorrow.
tomorrow.
So I think we can hand over his certificate, and for other 3 judges who are going to continue tomorrow, we can present them tomorrow.
Okay, okay. Okay, so I'll request Dr. Vinod Shah to do the honors.
Sure.
Sure.
Great.
Well, it's a great honor to have this certificate to Dr.
Sandil Kamanga.
Yeah, Samanda, for participating as a judge in the first DRPI International event. Congratulations.
Which is signed by all 6 chairs.
Thank you.
Maybe you can read that, Tarun. It's difficult for me to read clearly. Yeah, I can see all the 6 signatures, but the names and all, you can read it, I think, on my behalf. That would be great.
Tarun, should I read? Tarun?
Yeah, you can read, sir. No problem.
Okay. On behalf of SPD, a Society for Pharmaceutical Dissolution Science, presenting DRPI, Dissolution Representation International, in association with the AAPS, American Association of Pharmaceutical Scientists. Certificate of Appreciation. This certificate is proudly presented to Dr. Sandil Kamanga, Dean Faculty of Pharmacy, Rhodes University, Grahamstown, 6139, South Africa. for his valuable contribution as judge for DRPI World 2023 Finals for PhD postdoc industry category, a dissolution research presentation competition for young pharmaceutical researchers organized by SPDS in association with AAPS, event dated September 23, 2023. Signed by Patrick J. Sinko, President AAPS, Padma Devarajan, President SPDS, Saranjit Singh, Scientific Chair, DRPI International, James Pauly, Scientific Chair, DRPI US, Matthias Walker, Scientific Chair, DRPI, including Japan, Singapore, and other countries, and Dr. Kamal Dua, Scientific Chair, DRPI, Australia and New Zealand. And is supported by even ACG, SOTAX, and BASF. Thank you.
Thank you.
Thank you, Dr. Kamanga. Please accept this. And we will send you by mail. Tarun will send you by mail soon.
So you can download it.
Yes.
So,
Thanks. Tarun, you will have to close now.
okay, so I'll just end the webinar, and I'm sending the meeting link for the judges to, proceed further for decision making. Thank you very much. Thank you all.
Thank you all. See you tomorrow.
Bye-bye.
Some break.
Tomorrow, same time.
Yes, Sandeep sir, you're saying something? Dr. Tiwari?
Yeah, giving some break for 10 minutes or 5 minutes.
Oh, yeah, sure. No problem.
Yes. Take. Break of 10 minutes. No problem.
No problem. Absolutely all right. I'll send you the link. You join at your convenience.
Okay.
Within 10-15 minutes. Thank you.
We have all the time now.
This is only for judges, no? I need not.
Yes.
Only
Yes,
for
only
Thank you.
We
so
all
much.
can retire for the day.
Yes.
Yes.